Welcome everybody within the European Week of Immunization. We're starting the high-level meeting, Ukrainian Immunization Week 2021, routine vaccination during the COVID-19 pandemic. My name is Svitlana journalist. I will be moderating the round table initiated by NGO Parents for Vaccination and Ukrainian Ministry of Health. Today we will be talking about how pandemic impacts the routine immunization, what the government does, what international partners do, and what the public does to improve the coverage with routine vaccination. Are parents motivated by healthcare professionals, educators? What is their role in this situation? And our roundtable will involve all stakeholders from the government and NGOs. The broadcasting will be on Parents for Vaccination's website and on YouTube page. In YouTube there is a separate broadcast in English, and for participants who are in Zoom, I would like to state that in Zoom you gotta choose a language in your settings, either Ukrainian or English. So I remind you that on YouTube you can watch our roundtable in Ukrainian or English, on Facebook in English, and in Zoom you have to choose in the settings the preferred language. So we're starting our round table, and I invite for keynote address organizers and key partners of the event, Jarno Habicht, head of the WHO country office in Ukraine. Floor to you.
Thank you, and I hope everybody connected feels very well, and it's good to meet all of you during the European Immunization Week as well the World Immunization Week. I see you are connected from various parts of Ukraine, and I like to thank also the Ministry of Health, the Parents for Vaccination, but we have here also the Rotary of Ukraine, other partners meeting in this discussion as of today. First of all, before going to the immunization, I like to thank many of you because as we are going through the COVID outbreak and having difficult times for more than 1 year, it is important to continue. But I like to also thank for all of your efforts, the hard work, etc., etc. And we have still many months and the next year to go to ensure that we can scale up also the health services. I hear my own voice back, so probably not everybody is muted. So thank you. So what I would like to say maybe is the three main messages as we are organizing today's event and the whole week of European Immunization Week. First, we need to think that in the pre-pandemic world, every fifth infant in Ukraine remained unprotected and didn't have the full coverage of vaccines. So what we know is that even then, it was around 20% that didn't have the full protection. So we need to address that, and we know that as we have been going through the COVID pandemic, the numbers might be actually higher. So that's one, that the COVID situation has changed the environment for vaccination and particularly also for routine vaccination. Now, as we are moving ahead in 2021, we call for dual-track attention. First is to ensure that we're scaling up the COVID-19 vaccination to the priority groups and those in the higher risk, to go step by step that we can increase the coverage with the COVID vaccines available. And the second, to protect and scale up routine immunization for children and adolescents. So we need to do both things, scaling up the COVID vaccination as well to protect our children and adolescents. And we know that this is particularly tiresome. It needs a lot of our efforts, and I thank everybody who is joining in this road together to move ahead. And finally, I want to share with you our European Immunization Week key message, that vaccines brings us closer. First, to the universal health coverage. Second, to the fairer world. Third, to our friends. Fourth, to eradicate the polio. Fifth, the world without pandemics. And sixth, most important, to the family. So that's the key message. Vaccines really save lives, and in the time of COVID, nobody is safe until everybody is safe. Thank you.
Thank you, Jarno. Thank you for your speech. Now, I would like to give the floor to Tymofiy Badikov, Executive Director of NGO Parents for Vaccination. Floor to you. Good afternoon, good morning, everybody. I welcome you in this amazing event, Week of Immunization. Our organization for more than 5 years is already supporting Ukraine and parents of Ukraine to explain to them what to do, what vaccinations should be done. We always do awareness work in all regions of Ukraine, and a big part of our activity is debunking the myths. So this event, I think, is very important because here we are gathering all representatives of Ministry of Health and Ministry of Education and Social Policy and representatives from regions, from healthcare departments, educational departments, healthcare professionals, teachers, all people who are associated with vaccination, not only healthcare workers, but also people who contact with parents of children younger than 2 years old, nurses, other doctors, maternity houses. Why? Because the task of the government and international partners and civil society is not to find one, like Ministry of Health, and say, this is all their work, this is their specialty. No, this is for all of us. We are all working in this together. So I'm hopeful today that we will hear about successful cases in regions, so that other regions in which the situation with coverage is not that good, they can see how other regions do maybe better, and maybe they can unite and create new contacts, new connections, and they can take responsibility and change the situation, make a change. So this event is on routine immunization because regardless of COVID, other infections are not on vacation, and our task today is to prevent new epidemics in Ukraine, to prevent measles and other infections, to protect children from what science gave us, and so that we talk and discuss about scaling up the national schedule for vaccination, for required vaccinations in Ukraine. So I wish all of us fruitful work. Thank you to our moderator. Thank you to World Health Organization, whose activity in Ukraine in immunization for many years, everything would be impossible without them. Thank you to our technical support, and thank you to our Ministry of Health, Public Health Center, who are very powerful in their work. They've been working for more than 5 years, and we really have a lot of strategic documents that our organization, together with experts, helps to implement, so that it's not just on paper, so that it's making change in the country. So thank you, everybody. Let's start. So dear friends, I can see that in Zoom chat we can see a huge amount of our stakeholders, representatives of healthcare and educators from different regions, from small towns and villages. participants. We will be involving you, dear participants, in discussions in different panels. And now we will have the first discussion. We will talk about the current epidemiological situation on vaccine-preventable diseases. And we will compare routine vaccination coverage tendencies for children 0 to 2 years old and 6 years old in 2021 compared with 2020 and 2019. 2019 was one of the most successful years in coverage of children with routine vaccinations. We got as close as possible to the desired 95% of routine vaccination coverage. But of course, pandemic really had its impact, and even the most successful countries in this sphere are really troubled in this, and of course Ukraine too. So that's what we will be discussing in this panel, and we will also talk about vaccine supply status. And I would like to invite to give the floor to, we have our key regulators: Viktor Lashko, Deputy Minister of Health of Ukraine, Chief Sanitary Physician of Ukraine. We're also expecting Roman Rodina, General Director of Public Health Center of Ministry of Health of Ukraine. Also, we are connected to Vusala Allahverdiyeva, Technical Specialist, Program Vaccine Preventable Diseases and Immunization, WHO Office in Ukraine, and Fedor Lapiy, Head of National Technical Expert Group, Chair of the Board of NGO Parents for Vaccination, who is also here with us offline, and Alyona Mazhnaya, Consultant of Social Sciences and Behavioral Research, will also be connected to us today from the WHO. And we're also inviting other stakeholders: Valeria Vasilieva, Head of Monitoring of Adverse Event for drugs, vaccines, tuberculosis, and pharmacovigilance database from the State Expert Center; Iryna Voloshyna, Head of Communication Management from the State Service of Ukraine for Medicinal Products and Narcotics Control, and also representatives of departments of healthcare and regional centers of public health. So I'm giving the floor to the first. Viktor Lashko, is he here with us? No? Okay, then Roman Rodina is online with us, General Director of Public Health Center of Ministry of Health of Ukraine. Dear Roman, we can see you. Please, floor to you. Describe the situation for us in 2021. Good morning, everybody. We cannot hear you. Okay, we cannot hear you. Please check your settings. Can you hear me now? Maybe set your language settings. In Zoom settings, you have to choose the language or write to the technical support. Can you hear me now? Okay, you may start. Can you hear me? Yes? Yes, finally we can hear you. Okay, I will share my screen. Please tell me, can you see my slides? Our technical support will get back to you. You can see my screen? Okay. I'm very glad, dear colleagues. I'm glad to welcome everybody at our roundtable on Ukrainian Immunization Week. I would like to thank the organizers, NGO Parents for Vaccination, for this initiative, and all the colleagues that connected, because Really, today, when we're talking about mostly COVID-19 vaccination, it is very important for us not to forget about routine vaccination, because interruption of routine vaccination, the national calendar, the national schedule, even for a short period of time, it increases the risk of vaccine-preventable diseases. So we have to remember that we do not only have COVID, we have other infections that are also infectious, just like COVID, and there are effective vaccines that work in the whole world. So immunoprophylaxis is one of the priority areas of public health, and immunization is national safety issue, because in Ukraine and for everybody, safety is dependent on immunization coverage. I will stop on epidemiological situation with vaccine-preventable diseases in Ukraine, and then I will stop on key moments in immunoprophylaxis strategy in 2021.
У 2020 році скільки у нас було зареєстровано в абсолютній кількості.
On this slide, you can see situation in 2020, and you can see that the leader is the hepatitis B. After that, we have the infectious disease, and on the slide we can see geographically how these diseases are distributed. Hepatitis B, for instance, and the more bright is the red, the more intensive is disease. Also, we can see how pertussis is distributed all over Ukraine, and here it is the same situation. The bright is the color, the high is the disease. Here you can see measles, and also all of us know that in 2018-2019 we had an outblast of the measles. 130,000 people got it, and one of the reason was the low coverage by the immunization. Also, the company of additional immunization and intensification of the planned vaccination showed its results, and we can see that now just 230 cases of measles were registered in Ukraine 2020. On this slide, you can see epidemic parotid distribution in Ukraine, and as we can see, it's very popular on the west. And after that, there is the dynamic of the vaccine preventable diseases from 2016 to 2020. On this slide, you can see absolute number of cases. Here it is pertussis. We can see a trend for its reduction. And could you please fix these trends? And we will see the dynamics of the vaccination. I'm talking about that because we will see the direct connection between these two events. On this slide, you can see diphtheria situation. Here we have a peak in 2019. All of you remember the cases in Transcarpathian region, but thanks to the clear response of the regional authorities on vaccination of adults as well against diphtheria gave its result. In 2020, we didn't have a lot of cases of diphtheria contractions. The next one is epidemic parotid, 2016-2020 dynamics. Here there is a trend for its decrease. We understand that 2020 is a COVID year, and all over the world we can find less and less diseases. And here I'm talking about vaccine preventable disease, about tuberculosis, other diseases. We can explain this drop with the influence of COVID-19 to healthcare system, but also by the increased coverage, and also that we had lockdown introduced, and thanks to that, contact diseases decreased as well in 2020. On the next slide, we can see dynamic of hemophilic infection in Ukraine from 2016 to 2020. In 2018, we had a peak, and now we have a relative decrease of the infected people. Here you can see measles dynamics. In 2017-2019, we had an outbreak of this disease, the same as in other European countries. In 2020, we have just over 200 cases, and the next one disease, also contact, rubella, and here we can see the same drop as with other infection disease. It's very similar to measles dynamics. In 2018, we had outbreak, and after that, it decreased. And regarding the tetanus, when we will come to the vaccination coverage, we can see that the situation with tetanus is rather manageable, because if we compare it to the situation 2016, we can see an increase on some stages, but we need to analyze the causes, and one of them is a low coverage of vaccination. Hepatitis B, rather stable situation we have from 2016-2019. In 2020, there is a decrease, but we can explain it by the impact of COVID-19 to the registration of diseases in general. And now let's discuss prevention strategies that was confirmed in 2019 by the government. Here you can see the main work streams of this strategy, and it will be implemented by 2021. On this slide, you can see key indicators: 95% covered by planned vaccination. Also, we have 100% funding provision for vaccines purchase. Also, we have 95% of the first doses of vaccine against hepatitis B, and 25% of buffer stock of vaccines. And now we are doing 3 years planning for vaccines to have this buffer and to provide full-scale vaccination. You know, we have no problems with the vaccine except for the BCG that was eliminated, and now the situation is stable as well. But let's look at our achievements now in strategy implementations. You can see them on that slide, and I would start from calendar optimization on the right side. Here we do not have age constraints for vaccinations against measles. This decision was taken because a lot of people do not know their vaccination status, and vaccinations prevent us from the diseases. Also, the vaccination schedule against diphtheria was optimized as well. Also, immunization services were eased. The definition of so-called temporary vaccination point was introduced that any kind of institution under conditions of Ministry of Health conditions can do that. And also, the calendar was introduced against pneumococcus infections in 2020. Also, we reintroduce the work of National Technical Group of Experts on immunization. It works efficiently, and now it works on the COVID-19 immunization issues as well. And I would like to thank Fedor Lapiy, who is the head of this group, for his impeccable record in this direction. Also on the platform of Alliance for Public Health, there were preventive program introduced, including the program on mobile teams training that now make COVID-19 vaccination with different kind of vaccines. Also, immunization measures were reinforced. It is against hemophilia infection and some other diseases. And also, we moving on the schedule according to the WHO recommendations. And now you can see slides on coverage, on the immunization coverage. Here you can see 20 years to see the dynamic starting from 2007. Here you can see polio, vaccination by 3 vaccines, and the dynamics that we had after that. We can see in 2014 there was a kind of drop due to the deficit of vaccines. After that the situation was stabilized, but let's not forget that our target indicator is 95%, and we are still not there. And you know, the country was rather good in provision vaccinations against those infections, notwithstanding COVID-19 pandemic. We analyze the situation in the European countries, in USA, and there the percentage of vaccination coverage against this kind of infection was higher than in Ukraine. The next slide. Against pertussis, diphtheria, and tetanus. Do you remember I told you about the tetanus, that we still have it? And please look at the levels of vaccination. Sure, if you compare it to 2016, when we had a critically low coverage level, we are doing fine. But still it's not 95% our target that we need to achieve to prevent these diseases. The next one is parotitis and measles. That is the first doses of MMR. Here we can see that the situation is stable from 2008. We have a drop in 2016, and we almost achieve our 95% in 2017, 2018, 2019, and we are not that fine in 2020. Here I would like to highlight that the need for vaccination by MMR vaccine is critical, as according to CDC recommendations, if we do not achieve 95% of coverage all over in Ukraine, no less than 19 regions, we can have a new outbreak of measles in Ukraine, very similar to those that we had in 2018, 2019. That was my last slide, and at the very end I would like to tell you that during pandemic times it's very important to get all the required vaccinations for the children, because that is the foundation of their health for the life ahead. And vaccination provides protection at any age. There are no any age limitations. Temporary, timely limitation helps protects you and the people around you, and vaccination is a huge investment into the future health of our nation. Thank you very much. So if you look at the absolute number, there is a huge decrease of the new cases of these diseases, right? Is it connected to the fact that officially they were not detected, or that's a real decrease of new contractions due to the vaccination coverage, due to the less contacts between people, there is a better mask regime, better personal hygiene? Well, there are a few factors here. First of all, as I told, the levels of coverage are being increased all the time, and sure that those levels give that long-term effect that we register less diseases. But if you look at 2020, and that's what we've seen now, we had a huge decrease of disease in 2020. That is a global trend due to the impact of COVID-19. What does it mean? Due to the lockdown restrictions, people contacted less, and the level of diseases and those diseases are contact one were reduced. Also, people went to doctors less due to the lockdown restrictions. And I would like to give you one more example. If we look at the acute respiratory infections and flu for the last year, in April, May last year, we could see very low levels, and our curve was very low due to the lockdown that was introduced last year. Here we can see direct correlation to the limiting measures that didn't allow people to contact as much as usual.
Thank you very much, dear Roman. We're inviting Vusala Allahverdiyeva, Technical Specialist, Program on Vaccine, Preventable Diseases and Immunization, WHO Office in Ukraine. Vusala is online with us. Please, floor to you. Okay, Vusala Allahverdiyeva, is she here with us? A minute ago she was. Yes, I'm sorry, COVID has its corrections to the organization of roundtable and other events. Not always those corrective measures are pleasant, but we have to adapt. Is Vusala here with us? Yes, I'm here. Okay. So we will be able to see her, but we do not see her so far. We will be able to learn what is the situation in 2021. Can we compare our situation with the situation in the world? Maybe we are a bit in a bigger delay. Maybe we are in the same situation as Europe. We can compare. Okay. Can you see me? Okay, we can see you, but we do not hear you yet. You have to choose language, English or Ukrainian, in the Zoom settings. Okay. Ukrainian, choose Ukrainian. Please choose Ukrainian language, then we will be able to hear you. Maybe say something, maybe we'll be able to hear you. Can you hear me? Not yet. Please, technical support, text to Vusala in the chat so that we know what to do. Please say something else, maybe we can hear you now. Can you hear me now? It's better already, but still quiet. It seems like the sound is working in Zoom, but we do not hear you here. Our participants in Zoom say that they can hear you. Okay, now. Can I start? Good morning, everybody. Thank you for this meeting. Thank you for the organization. Thank you to the parents for vaccination, because it is really huge work that you've done, that you're doing every year during the European Immunization Week and in the end of the year when we are celebrating the annual progress of strategy implementation on immunization. I am congratulating the organizers, commending the organizers of this roundtable, NGO Parents for Vaccination and Coalition for Vaccination in general for active participation in immunization program in Ukraine. Today my presentation will be very short. I will stop on the most important issues, the most important concerns we've seen in 2020, and of course it's going to be first of all about the routine immunization. What is important to remember for all of us? Since last year, until a certain time from 2010 to 2017, Ukraine was in the list of countries that had the lowest vaccine coverage in the world. Especially it could be seen in 2016 and 2017, when the strategic advisory group of experts on immunization of WHO included Ukraine in 10 countries with the lowest coverage of DTaP vaccination coverage. And Ukraine, unfortunately, was at the top of that list, together with Equatorial Guinea. Today, unfortunately, fortunately, Ukraine is not in the list, and the global data we have, they show that Ukraine is close to the numbers that are mean with the world coverage, that are similar to the average numbers in the world. But unfortunately, in the European region, Ukraine has one of the lowest coverage, and in European region, due to the infrastructure of healthcare and the resources, performs immunization coverage with much higher indicators than mean indicators in the world. But unfortunately, in Ukraine, they are similar to those that are average in the world. What is important to note that, regardless of the pandemic, all countries of the European region and Ukraine took all efforts in order to stabilize the routine vaccination and to prevent all the quarantine restrictions and the workload of healthcare facilities to prevent the decrease in vaccine coverage. I can say that regarding some vaccines, the government was successful in it, and if we look at numbers of 2020 given by our Ministry of Health with COVAX system, these messages show that the coverage among children up to 1 year with 3 doses of DTaP vaccine against diphtheria, pertussis and tetanus is at the same level as in 2019. It did not decrease, did not drop, and it is the coverage of 80%. It is the minimal coverage so that we can say that we prevent the outbreak in this cohort of children. But it is not enough. If we have this level of coverage for several years, if we do not go beyond 80%, then during all these years we will accumulate the group of unimmune children, and as soon as they reach the cohort of one newborn cohort, we are expecting the outbreak within this age group. And we're looking, in the last 3 years, we are accumulating about a cohort of children, about 40% of children who did not receive vaccination in 2018, 20 in 2019, and 20 in 2020. We can see that gradually we're accumulating unimmune children that can give us the outbreak. At first, it's going to be among children younger than 5 years old, and then it can transmit to adults. If we're looking at polio coverage, last year, due to the huge efforts at national and regional level, all facilities of primary health care really tried to prevent polio vaccination coverage drop. We could improve the situation even compared to 2019. The coverage in country mean it is 83% for the first time since 2015, since 2016, when we had rounds of vaccination due to vaccine-associated polio outbreak. It tells us that in these 3 years, unfortunately, we accumulated enough unimmune children in this cohort, and it is already close to 100%, meaning the complete age cohort, which again can lead to outbreaks in this key population, in this age group, outbreak of polio, including wild-type virus outbreak and vaccine-associated virus, outbreak. And measles vaccination, the last column, and here I gotta say that regardless of all efforts in regions, we failed in keeping the high numbers of coverage that we saw in 2019. Unfortunately, measles vaccination, it actually improved in 2018-2019 compared to previous years where we had 45% or 70% of coverage, but unfortunately again in 2020 we could not keep this success and we lost 10% both for the first dose and for the second dose in Ukraine. Again, for measles, if we, in order to say that we are protected, we need the coverage of at least 95% so that we can talk about vaccine immunity. Unfortunately, we could not reach this number last year. And again, this cohort is accumulating this unimmune layer of children in the age of 1 year old and then in the age of 6 years old. And of course, in these age groups, an outbreak is possible next year, and yes, maybe today we are not registering any cases due to the workload of the surveillance service, but again, this unimmune layer of children may become a problem. You can see the tendencies that we observed during the last year. Blue and orange columns are coverage in previous years on all antigens for children under 1 year old, and these green columns are monthly evaluation for 2020. And I have to say that almost all regions could, regardless of the drop in March and April of 2020, to reach the relatively high numbers of coverage for almost all antigens, but for all vaccines. But if we're looking more closely for some vaccines, such as DTaP, third dose, and MMR, the coverage unfortunately dropped after November too. You can see how unstable the coverage dynamics is. After April, we can see the surge, but in November we can see the decrease, and in some regions in December, and we can see that in December the coverage dropped, and if we could keep up the November tendencies, we would have the higher overall coverage. But I have to emphasize that we've been working together with Public Health Center, with regions, with participation of national facilitators monthly, with mentoring of our international partners, and the regions that showed low levels in April and later in October, September, some of them managed to improve their coverage, and they could improve the forecasting that we gave in September, October 2020. I would like to emphasize that if we take a close look, some of these regions, regardless of the fact that in all of these regions the coverage is lower than average in Ukraine, some of these regions, such as Chernivtsi, for example, or Lviv Oblast, they managed to improve their coverage compared to the forecast that we gave in October, September, when the forecast for the end of the year was a bit higher than 60%. But I would also like to emphasize that it is important to continue the work and to keep control over the situation and keep up with our efforts throughout the year, because some oblasts, such as Odessa and Ternopil, that showed relatively higher numbers in the middle of the year and in the end of the third quarter, unfortunately by the end of the year they had low overall coverage, because in the last months of the year they did not manage to keep up the stable level of coverage as in the first 3 quarters. What is important to remember for all of us is that, yes, now we are performing the COVID-19 vaccination, we are performing it in the key populations that have the highest risks of COVID. Children and adolescents are not part of this group. And we have to remember that we cannot allow the situation where children and adolescents have outbreaks of vaccine-preventable diseases, because it will affect the adult population too, the adult environment. As soon as the outbreak among children starts, these diseases get transmitted to adults too. This year, the motto of European Immunization Week is "Vaccines bring us closer." Vaccine helps us keep our relationships with our relatives, in family, with our co-workers, friends, because due to vaccination we feel ourselves protected and we can continue our normal life.
It's very important during those COVID times when our many force are directed on the medical employees vaccinations, all the population, keep on giving resources, staff and time for vaccinations for children and adolescents. We cannot mix these two processes. Let's divide them in time, in place, but we keep on going give vaccinations in both directions, because those risks of children vaccinations will reflect very soon on all the population, and while we will protect them from COVID, we can protect from other vaccine-preventable diseases. That was my last point. Thank you very much, everyone who could join us today. Thank you. Thank you very much. And now we can see Fedor Lapiy in Zoom. And Alyona Mazhnaya, consultant on social sciences and behavioral research, is with us. Alyona, welcome to our event. Can you hear us? Alyona Mazhnaya is in Zoom with us. And Alyona will tell us. Alyona, we can see you. Good morning, and a good sound as well. Okay, could you tell us, please, what promotes people to disrupt vaccination or to start doing it after some break? Could you please tell us about Ukrainians' behavior in 2021 in these directions? What changes did you notice? Thank you. Thank you very much for the possibility to be with you, to listen to those interesting presentations, to speak to my colleagues. Thank you very much for your questions. Today I can present you the results of WHO research that is done together with the Public Health Center. And here we can see behaviors, attitudes, support and measures on COVID-19. But within research as well, we had a rather wide section on vaccination. That's why I will try to share these results with you briefly and to invite the colleagues who are interested in this topic to contact me directly. Okay, that research we had from May 2020. That is a representative research for the whole Ukraine. The research is designed in such a way to research the perceptions of risks, behavior of measures in Ukraine, and how information is perceived on COVID-19. My slides will be in English, but I think it's better for you to listen to me in Ukrainian, right? Sorry for this mix of languages. I would like to start from the main thing. Which takeaways did we have from 2020? Here you can see three main takeaways on vaccination. First of all, in our data, there is no significant changes in the intentions to be vaccinated if we compare to the October 2020. Second takeaway is that there is an important role of safety and side effects concerns. We can see them in the intentions for vaccinations. And the third takeaway is that it is an important role of potential positive effects of vaccinations. Here I mean social effects. And every of these three messages has practical implications. If we are talking about changes in vaccine acceptance, here we can see a huge difference between different demographic groups. I mean the intentions for vaccinations, target approaches, and also target approaches to the groups that have low vaccine acceptance. Here an important strategy is to involve doctors and healthcare employees to promote vaccination level, because their role is important as a source of information, positive social example, and logistically, population of Ukraine will go to the institution to get vaccinated. Regarding our second takeaway, safety and side effects of vaccine, here we need to communicate it clearly, transparently, and in simple words. And regarding the third takeaway, positive effects of vaccination, use of these positive effects in communication campaigns, will help us to increase the positive perceptions of vaccine. And now I will show you the data on which we based our takeaway. Here you can see the percentage of people who strongly agree that COVID-19 vaccine will become accessible for them and they will get vaccinated. And we compare it starting from August 2020 till March 2021. And this indicator didn't change a lot, because limits show you that this indicator didn't change from 2020. But also we can see that percentage of people who were not certain in vaccinations is reducing slightly. It shows us that we are losing in communication, we are losing in work with those who doesn't have negative perceptions of vaccinations, and we can convince them easily. Also, if we look at different categories of people, male and female, different age categories, here we can see 10% difference. Women are 10% more positive regarding vaccinations. If it becomes recommended, they will get vaccinated. Also, there is a trend in age differences. If we look at the people of different ages, the difference is about 15%. Those who are older than 50 years old are 15% more perceptible to get vaccinated. Here there are two main demographic groups, and we can start working with them on vaccination perceptions. Also, if we look at the role of the social norms, we will see that those participants confirming that in the case of vaccine availability and accessibility, the majority of their friends and relatives will expect from them to get vaccinated. Here we have almost 80%. Here we can see positive role of social norms. Also, personal experience, when people see themselves severe consequences, change the trend. If, for instance, people have some friends and relatives who died from COVID-19, it changes, but not much. It's about 7% difference. Also, if we measure the awareness on COVID-19, we can see that the majority of population thinks that it's easy to find information on vaccination, but half of the population think that they can evaluate if this information is reliable. And also we can see that there is a need of awareness raising regarding vaccine, regarding recommendations, but at the same time, those indicators do not impact their intentions to get vaccinated. Also, what impacts and the general attitude to vaccinations among those people who think that all the population should get vaccinated according to the national immunization calendar, the percent of those who got vaccine against COVID-19, it's about 60% if we compare it to those who think that not everyone should get vaccinated according to the national immunization calendar. And also regarding COVID-19 vaccination, we asked our participants which factors are important for them and how important are them to take the decision to get vaccinated or not. And we can see that the three most important factors are side effects, use of vaccine in other countries, and country producer of the vaccine. We cannot influence them in our daily life, but also we can have some positive news in this data. I mean that about 50% of population are absolutely confident in the safety of COVID-19 vaccine, and also we can see that there are small differences among their age and the place where they are living. It shows us that concerns about the safety of vaccines, that's one of the factors that can contribute to the intention to get vaccinated. Also, among positive news, we can see more factors that also can be used for communication purposes. First of all, here there are positive social effects of COVID-19 vaccination, the possibility to see family members, possibility to travel, possibility to have less lockdown restriction in their life. Also here there is WHO recommendations and recommendations of family doctors, as these factors were recognized as important in taking the decision to get vaccinated. Regarding logistical part of the vaccination campaign, here we can see that the most popular places where people would like to get vaccinated are family doctors' offices and health center clinics, public health centers. So we can see that the doctors of primary health care are at the same time the sources of information on vaccinations. Their recommendations are considered to be reliable in taking the decision, and also logistically they are winning as well. And at the end of my presentation, I would like to connect our data to the preliminary data and this information that my colleagues told you already. We asked our participants if they postponed routine vaccination for themselves or their children, and here we can see that the number is rather stable. If we compare it to August 2020, it is still at the level of 10%. 10% of the population inform us at every stage that they postponed routine vaccinations. But usually we are asking about the last 2 weeks of their life. But if we look at it progressively, how many people postponed due to the restrictions or some other factors, these data show us how we can address these issues. That's all from me. Thank you very much for your attention. Thank you very much for your invitation and possibility to share this research result. Thank you very much indeed. You know, we have a separate panel regarding sociology because it is important for the whole process, but I have one question. Do I understand right that women trust vaccination more than men? Why is that? Thank you very much for this question. Yeah, you are right. Women do trust more. That's very interesting takeaway from our research. Now we are trying to understand the reason ourselves, and we have several hypotheses on that.
If we look at the source of information that our participants trust the most, top 3 sources of information are Ministry of Health, World Health Organization, and at the same time friends and closest environment. So we see that the sources, the Ministry of Health and World Health Organization, are in the company of social environment. And if with the first 2 sources we can control the information the public gets, but regarding the social environment, its impact is very unpredictable, and one of the hypotheses is that maybe for women this impact is stronger. But again, it is a hypothesis, it is not confirmed, but I hope that the situation will improve. Thank you very much. Thank you very much. Alyona Mazhnaya is connected with us. Please stay with us. Maybe there will be questions from participants. And now I'm giving the floor to Fedor Lapiy, head of National Technical Expert Group and chair of the board of NGO Parents for Vaccination. Please, floor to you, one of our not many offline participants. Good morning, good afternoon, Tetyana, Tymofiy, and all of our participants. This year has started with the hope that Ukraine will increase vaccine coverage, but pandemic ensued, and we are forecasting that it's gonna last. But since the beginning, we felt the drop in vaccine coverage, and this drop was noted not only in Ukraine, it was noted in the USA and many European countries, many South American countries, Latin American countries had problems with vaccine supply, because we cannot say that there is one country in the world that fully supplies, that is fully self-supplied with vaccines. So in order to address this situation in Ukraine and in the world, there were certain steps were undertaken. First of all, I would like to comment on what we have done in Ukraine, regardless of international partners. In the first months of pandemic, the Ukrainian Academy of Pediatric Specialties made a public statement together with Ukrainian Association of Pediatric Immunology. Two societies united, and at approximately the same time we published the guidelines from the WHO were also published about routine immunization during COVID-19 pandemic. In the country that has just suffered a huge measles outbreak, came into 2020 still having measles. More than 200 cases during 2020 were registered. And if we scale down, it will be possible that regardless of the quarantine restrictions regarding COVID-19, the COVID-19 patients would be joined by many measles patients. Beyond the measles outbreak, we can talk about tetanus and diphtheria cases. In case of absence of vaccination, there will be an increase in the number of cases, and these patients will need hospitalization, including into the ICU. And we can say that during the immunization week, by 22nd of April of 2020, the statement from the Chief Central Physician of Ukraine was published on legislation regarding the COVID-19 vaccination in Ukraine. And on 16th of April, we had the first meeting of the new National Technical Expert Group on immunoprophylaxis, where we outlined the plan of work for 2020, and in the beginning of June, all of the documents and positions that were published, position papers that were published, we're talking about the WHO guidelines, about the position list of professional organizations in Ukraine, the statement by the Chief Central Physician of Ukraine. They were joined by the statement of National Technical Expert Group on Immunoprophylaxis regarding vaccination, routine vaccination during the COVID-19 pandemic. And I have to say that in March, in April, in May already, multiple online monitoring visits were held that were supported by the WHO, during which, when talking to physicians, the general physicians, the primary care physicians, we raised the issues of safety of routine vaccination during the COVID-19 pandemic, spreading the message that if we, dear colleagues, do not renew the vaccination for the required infections, then in addition to COVID-19, we will have another outbreak. And we can say that we've ended 2020 with dignity, with better results than we expected even, because I'm very grateful to all my colleagues, healthcare workers, that during summer and autumn could catch up the vaccination of children that were missed in spring, so that we can really talk not only about the protection of society in general, but protection of separate individuals, children and adolescents. And I think it is also due to the work of National Technical Expert Group on Immunoprophylaxis, because what we're proud of, not only about our position on routine vaccination during the pandemic, the National Technical Expert Group created the position for Ukraine. It is very important for healthcare workers, especially those who work in maternity hospitals, on newborn vaccination against TB, BCG and hepatitis B, in case the child was born to mother with COVID-19 or with suspicion to COVID-19 infection. And I think that these things will be evaluated from distance in several years. But already now I would like to thank all of our colleagues who joined this work, this activity, the results of which can be implemented by healthcare workers and which patients can also use to find information. Fedor Ivanovich, on the rights of moderator, I would like to ask you a question. Unfortunately, we did not hear the question. We started in 2020 with the deficit of DTaP vaccines, with DTaP vaccines for revaccination at 6 years old and for vaccines for adolescents and adults. And we also had an interruption in vaccine supply of BCG, TB vaccine. But since the middle of February, these vaccines appeared in numbers that are enough in order to catch up, to cover this gap. And I can say that at the moment, in the end of April 21, our numbers are not worse than in 2019. But we should not relax. We should keep our focus, because measles cases, regardless of anti-pandemic restrictions, they are registered, and of course quarantine restrictions, they prevent measles spread because children are on online studying. But everybody still wants to go back to normal life, and as soon as we get back to normal life, it will contribute to the spread of measles if we do not vaccinate children. Nevertheless, this weird spring will stop and the warmth will come. and we will spend more time outdoors. It is very good for your general health to sit less in front of the monitor, to spend more time outdoors, more physical activity. And for COVID-19 prevention, it is also important as a barrier for COVID transmission. But we have to remember that children are children. They fall from bicycles, from trees, because they helped neighbors together to pick up the apples from their tree. They can get infected with tetanus. And tetanus, if we're talking about children, it needs hospitalization to the ICU, and this can be easily prevented by timely vaccination. If a person is vaccinated, they do not need post-exposure prophylaxis after trauma. But summer has its consequences. Even if we're talking about the neighbor's, not talking about the neighbor's apple tree, we can have cats or dogs, we can swim in the river, and it can give us more risks of tetanus. So here I would like to say that we have to prepare for the summer. Many parents think that we are in the situation where due to pandemic it is better not to visit a healthcare facility and not to vaccinate children, because we know that the primary healthcare physician might have just had a visit with a patient who has COVID. What would you tell to those parents? So how to put priorities correctly? That would be my answer to your question. I would agree that you should not visit healthcare facility an extra time during the pandemic, but if you look at the situation in the beginning of 2020 in the USA or in other countries, all of them noted, and in Ukraine we also note, attendance of healthcare facility for vaccination is a good reason for visit, because in that way you prevent many other infections, which the relevance of which does not drop or decrease or is eliminated due to COVID-19. So what do we require from parents? We require from the leaders of healthcare facilities organize the work in a way that will provide safe work environment for healthcare workers and safe environment for patients' visit for vaccination. It is a good reason for visit, and we have a recommendation in Ukraine on how to organize this process safely. Just take the recommendations, follow them. We have recommendation and position of the association that we can perform multiple vaccinations in one day. We can recommendations that every visit to healthcare facility that happened due to any reason should be used to check whether you have all the vaccines needed, because tomorrow you might have a trauma and then we will need post-exposure prophylaxis, or you might have contact with diphtheria or measles, and we have to be timely in preventing the infection. And we are really emphasizing this for healthcare workers. Every contact with your patient should start from checking the immunization records. If there is the skip and the patient is on a visit, suggest them vaccination against the antigens that were missed, because the vaccination works when it is performed, and it is most effective when it is performed before contacting the infection. It is like a safety belt. Thank you very much. Dear friends, I know that we have in Zoom many people who are very interested in immunization of the public, educators and healthcare facilities and NGOs. And there is a question from our participants in Zoom: can you perform immunization of adults against COVID and DTaP at the same time? There is an answer. Today in Ukraine, we recommend to keep the interval between COVID-19 vaccination and other vaccinations, including DTaP vaccine, for 14 days. 14 days before, 14 days after. But if we're talking about post-exposure prophylactic, there is no problem, no intervals, as I've said, with the example of trauma. So please keep the interval of 14 days. Some countries shortened it to 7 days, and it is not linked to risks on vaccine safety. It is more linked to the fact that we want to delay in time if there is a fever, a reaction to COVID-19 vaccine, which is possible. It is also possible that it happens due to DTaP vaccine, so that COVID-19 vaccination is not the one to blame.
And now we have in Zoom representatives of the Ministry of Health of Ukraine, Public Health Center. If you want to send some message or to give some reaction, please join us in Zoom. You can ask your questions in Zoom chat. Maybe some participants at the moment would like to ask some questions or to be involved in some other way. Is it the same position on kids? Yeah, exactly the same. The only difference is that it cannot accept it at the moment, as COVID-19 vaccination is not allowed for children, and the only one that can be used for children starting from 16, it is Pfizer vaccine. That's still not in Ukraine, so most probably the position will be the same. But there is no routine vaccinations for children at the moment. The only exclusion is clinical trials. And how it can interfere with tetanus vaccinations. It can be done after isolation period, 6 months or more. You can wait. There are recommendations for the countries in the world, in Ukraine as well. And in Ukraine, after vaccination period is over, after isolation period is over, COVID-19 vaccinations can, tetanus vaccination can be done. Thank you very much. And now we have Tetyana Pashkar from the monitoring department, from surveillance department. Tetyana, can we see you?
Я нагадаю, що з нами на прямому зв'язку також є і Державна служба України з лікарських засобів.
State Service of Ukraine on medicine is also with us at the moment for medicinal products and narcotics control. Are you with us? And the State Expert Center, one of the key institutions in this sense. Do I understand it correctly? That's institution that gets order from the Ministry of Health to have expertise of the materials, and also at the State Expert Center there are consultancy groups, there are specialists, scientists in this group who make this expertise from the point of view of safety, efficiency, and then they recommend Ministry of Health to register some medication or vaccine, in our case in Ukraine, but the procedure is being provided by the state expert center, and in Ukraine the center can make pharmaceutical surveillance, so collection of information on efficiency and safety of vaccine, how it will promote immunization. That's exactly what State Expert Center is doing. And this information is open. I think Tetyana will tell us about it later. And the function of this system is very similar to American system wires. I mean, when signals are being submitted, and they can be submitted not just medical employees. We have our next speaker, right? I cannot see her at the moment. Maybe you can see her in Zoom. Yeah, we can.
Валерія, да, доброго дня.
Начальниця відділу моніторингового менеджменту несприятливих наслідків застосування лікарських засобів, вакцин, туберкуліну і ведення бази даних департаменту фармаконагляду Державного експертного центру.
So, the Tetyana is the representative of State Expert Center, Valeria. Valeria, please join us. Could you please tell us what's going on in this sphere? Hello everyone, I'm very glad to see all of you, and that's a very important event, and those who organized it. We know for sure that European immunization weeks are going on every year, and there are a lot of issues that we can fix during this event. You can hear me, right? Yes, we can. Yeah, we can hear you very well, thank you. I would like to tell you that pharmaceutical surveillance is done by the State Expert Center. Those functions are within State Expert Center in the Ministry of Health of Ukraine, and that's a very important detailed job, because we are collecting information on all unfavorable signs after the immunization according to Ukrainian protocols, according to classification recommended by World Health Organization. All the cases of unfavorable events after immunization are given by medical employees, also by the patients and other applicants representing vaccines on the Ukrainian market through automated system of pharmacovigilance. This information pharmacovigilance system works in our country starting from 2017. That is a very convenient tool that allows to fill in the information card and to send it to the State Expert Center. According to the requirements of pharmacovigilance, all adverse events after immunization are being given to the State Expert Centers, but if there are some serious or group events, there is an investigation of them on the level of regional groups of operative reactions in every region. By the order of the Ministry of Health, there are regional groups of emergency response that work according to the provisions about regional response groups. After the investigations, after some serious or mass event, the protocol is being filled, where there is a category of cause and consequences. All other events are fixed in the database. The ones that I told you about, this automated pharmacovigilance system. And after that, this information is being generalized every quarter. Generalized information then is being published on the website of State Expert Center, and it is accessible for the wide public, who can see the frequency of registered adverse events after using vaccines for routine immunization. And a lot has been said today that immunization coverage due to the pandemic is lower this year, but I would like to highlight that we've also noticed in 2020-2021, I mean the first quarter of the 21, that information cards on adverse events are also reduced. If we compare it to previous years, it was 2 times more frequent in comparison with 2020. That's why I want to say one more time that pharmacovigilance is going on in Ukraine at a rather high level, and in order to have these adverse events following immunizations that can be foundations for the future medical guidelines on adverse events, it is necessary to fill in those information cards, and then based on analysis the corresponding regulatory decisions should be taken on the level of the ministry. So, in Ukraine, 4 vaccines against COVID-19 are registered, and we received some information on them. All serious events that were registered as the ones that we had investigation protocols, there were adverse events or in unfavorable time, so they just happened to be in the time of the immunization, but also we had some unexpected events, the signs that were not provided in the guideline for medical use, and all those cases were sent to the Central Group of Emergency Response and the Ministry of Health. And that's possible that all those cases will be the base for the new guidelines for the medical use, how to use vaccination against COVID-19. Pharmacovigilance, as I've already said, has a key role in this process, and I would like to ask everyone to fill in information card to send them to us in order for all of us to be fully aware in the efficiency and safety of utilization of vaccines in our country. Thank you very much indeed for your attention. So that was Valeria Vasilieva, who is the head of monitoring, who is the head of Department for Surveillance and Management of Adverse Events associated with drugs, vaccines, tuberculin, and other pharmacovigilance database. And now we are going from statistics to a very large scale sociology. Let's discuss how pandemic of COVID-19 impacted routine vaccination in Ukraine. Our participants will analyze the surveys among parents employees of education facilities, healthcare, and Tetyana Novak, who is the expert of Coalition for Vaccination, is with us. Also Yevhen Grechukha, who is also expert of Coalition for Vaccination, and Anna Sukhodolska, Director of Communication Programs for UNICEF Development in Ukraine. And now I will briefly tell you about the survey itself. It was partially announced by Alyona Mazhnaya, our previous speaker. It was a kind of spoiler of that survey. It was made in May last year. It was a very large-scale survey, 75,000 respondents from educational, from healthcare spheres, and parents as well. And now we can know more details how pandemic influenced routine vaccination, how teachers, doctors, and parents perceive vaccination. Tetyana, the floor is yours. Hello, everyone. We would like to share with you the results of the survey. It's not a survey, it's more like the breakdown of thoughts and opinions of this topic. Can you see my presentation on the screen, please? Slides for surveys, please. And I would like to add that this survey that was made by NGO Parents for Vaccination, they are also organizers of our today's event. Yeah, we had it for the 7 days. The interpreter cannot hear the sound properly. The sound is very poor. It was done among educational institutions. Also, there were some doctors of the high category. The sound is very poor, interpreter cannot hear properly. Also, it was in-depth research. With a list of questions. So we have less information from educational and healthcare workers and more from parents. Now we can see the slides on the screen. Our participants in Zoom can see them as well, right? Let's start from the responses of educators. So we had 16,000 people. Most of them were women.
Regarding the age groups, we can say that 52% were people aged from 40 to 59 years old, and I would like to note that the questionnaire, the survey was held in all regions of Ukraine. All the regions participated. The most participants were working in the secondary school facilities. The next question that was stated in the questionnaire is whether your educational facility has a healthcare worker employed, and most of them answered yes. The next, in your opinion, is vaccination important? 69% agreed to the question, 23 were hesitant to answer, and 8 answered no. we can see the distribution here. Please state whether children for studying in your facility are required to provide information on vaccination. It is a requirement in 49% of the facilities. The next question: do you think that ban from studying in school for unvaccinated children is legal? 23% agree with this statement. Do students of your facility receive information on infectious diseases? Here, the respondents could choose several answers, and we can see the distribution that within the educational program, 67% receive information on infectious diseases, 40% involve healthcare facilities, and 38% with involvement are involving this information as an extracurricular activity. The question on vaccination, Tetyana, I think your mic is not working. I'm sorry, is the sound working already? Okay, we're going further. In your opinion, is there a need for conducting awareness activities on vaccination with staff, parents, students in your facility? Yes, 60%. This questionnaire also included 2 questions regarding vaccination, COVID-19 vaccination. And in their personal opinion, if it was their turn, if they had the opportunity for educators, 37% would use this opportunity. Not planning to vaccinate 58%. The next question was whether the leadership of the facility gathered information on readiness for COVID-19 vaccination. 89% did gather this information. These were the results of questionnaire of survey among educators, and in our next segment we are presented the results among healthcare workers. In this questionnaire, 947 participants took part, and most of them were women. The questionnaire was held among all regions of our country, and age distribution you can see on the slide. Among the respondents, most of them were family physicians, pediatricians, and nurses. Most of them work in communal, non-commercial enterprises. Very few of them were from the private practice. Consulting. 82% responded that yes, they're involved in the process. If you're working in a communal non-commercial enterprise, does facility has enough staff for routine vaccination? Yes, enough staff in 81% of facilities. There is a deficit in 12%. The next question was regarding the opinion on vaccination during COVID-19 pandemic. Is it required to continue routine vaccination? Yes, 87%. And still, some healthcare workers did state that they are hesitant to answer, or they are definite that it should not be done. In your experience, compared to last year's, did facility visits change for routine vaccination? Yes, 44% had decrease in vaccination visits. The same percentage had no change, and there were even respondents that stated that the number of visits increased, but there were only 10% of those. For healthcare workers, we also included 2 questions regarding COVID-19 pandemic vaccination. Are you involved in the COVID-19 vaccination process? 49% are involved. Are you vaccinated? 44% are already vaccinated, and 39% are not vaccinated but are planning to do it, and do not plan on vaccination, 17%. And now we will switch to survey among parents. We will draw some preliminary conclusions and results, but I have to say that this survey is not a study, and we see that we want these results to be the reason for further full-scale research with a representative sample for all Ukraine in order to implement effective interventions for improving immunization. Tetyana, thank you. And Yevhen Grechukha, MD, expert of Coalition for Vaccination. Please, floor to you. On attitude of parents, it is interesting on how it is different. Thank you. I will add a bit to what Tetyana said, and I will say that educators that want to vaccinate now, right now, we're in the 3rd stage of vaccination, so be ready that you will be contacted soon and you can get the vaccination. Yes, educators can vaccinate right now. We're in the 3rd stage. They are in the list of the 3rd stage, and we are gathering information in order to define a problem. In case you changed your mind, you will still have the opportunity to vaccinate or contact your family physician. They also make lists for vaccination. Either do that or contact your administration. Healthcare workers should have already been vaccinated, but again, some colleagues refused vaccination and they changed their mind. They can also get vaccinated now. And the last huge section of our questionnaire was parent survey, and we did not expect this number of respondents. Our plan was 1,000 of respondents, but we overachieved the target by 75-fold, and 75 respondents is the number we had. 75,000. We are opening these slides, and there are some questions in the chat. Kherson. Which city had the most respondents? Kherson and Rivne. And I would like to say that today we presented not the whole scope of questions that were included in the survey. There were also some open questions. So the detailed analysis will be provided later, because we were also interested in hearing comments on open questions. So there is a pool of information that is yet to be analyzed. So now we are going to talk on parents survey. Again, I would like to say that 75,000 respondents were involved. It was an online survey. We involved public agencies, executive organs of Kyiv city and regions, departments of healthcare, communal non-commercial enterprises. The survey was anonymous, so in case you participated, don't worry. It is all anonymous. This is just for you to get familiarized with the content of the survey. These were the questions asked, the gender of the respondent, the age, do you have your children, do you vaccinate your children, and whether you have children is an important question because our focus group was parents who have children. If you vaccinate your children, what kind of healthcare facility you attend, etc. You can see that in the beginning we performed the verification of data. At first we had 75,000 respondents, but only 62,000 of them were filtered into the definitive sample. 12,000 were filtered out, and already we have another filter of whether you vaccinate your children. 8,000 responded no, and 54,000 responded that they do vaccinate their children. So 87% of our respondents do vaccinate their children. Here you can see the regional distribution. You can see the involvement of regions in recruiting of the respondents, and really Kherson region, Dnipropetrovsk region showed the highest participation. In some, and even due to the limited time, we gathered 62,000 respondents. The mean age was 36 years old, and again, women are showing their leadership, they're showing the highest involvement. We had 19-to-1 distribution of females versus men. The mean age of children was 6.7 years with focus groups. Since from the very beginning we have focused on children within the first years of life, from 0 to 2 years old. And here we also had a huge group, 3,000 of children for children up to 2 years old, and almost 6,500 of children from 2 to 6 years old. And the mean number was 2 children per family. 97% of them attend educational facilities, almost all of them, and 55% are attending extracurriculum sections, extracurriculum activities. Also, the respondents gave us information on the form of property for facilities that they attend, and most of them attend public facilities, most of the parents who vaccinate their children. It is 46,000 of respondents. The category of parents who do not vaccinate their children, 60% of them vaccinating healthcare facilities, or there is also a group of parents who attend both types of facilities, and some of them stated that they go to other types of facilities or that they go abroad for vaccination. We have to say that in the biggest part of parents who vaccinate their children are in public property facilities, and also the highest number of parents who do not vaccinate their children are there. Also, we had the question on the questions that the parents are most interested in regarding vaccination. They're interested, first of all, on the quality of vaccines, and they are looking for information on vaccine quality.
And here we have 76% of the respondents. And also the conditions of the vaccine storage, 44%. Regarding the source of information about the vaccines, the most reliable is medical employees, as you can see. After that, there is internet, media, social media, relatives and friends, and some topic groups in the social media, Facebook, for instance. It's a part of internet, but not exactly. The main source of information are medical employees. So it's very logical to ask parents if they trust medical employees. And yes, 73% of them do trust. And also we ask questions to the parents who do not vaccinate children. And here we can see top reasons of the refusals, because there are doubts regarding the quality of vaccines, safety of vaccines, also when there is, if there are some kind of concomitant diseases, for instance, allergies, most often also autoimmune diseases, and total distrust. But also there is an order for medical employees with all the recommendations what to do in these situations, and also there is a list of diseases with which you cannot do vaccination. Why it's not in the percents? Because the distribution is rather equal. It's about 25% of parents do not vaccinate their children, and here you can see those 25%. And also target groups and vaccinations during COVID times. We were interested in changes in target groups. First, we asked all the parents who vaccinate their kids if the schedule for vaccination was changed. And they did 48% didn't know about any kind of changes. In 30 cases, there were no changes. And in 21% the institution informed about changes. That's a very sad situation about those 48% that they didn't inform. And we also understand that it impacts the decisions of the parents. Regarding those 30% who didn't have changes, and 21% that they were informed about changes. And the next question was, did children miss their vaccination during lockdown? Among all the children that have been vaccinated, 16%, 9,000, missed their vaccination during lockdown. 16% is rather significant number for the future. But the focus was on kids younger than 2 years. And yeah, they did miss vaccination in larger numbers. Almost 51% missed their vaccination on the age 0 to 2, and those kids from 2 to 6 years, it's 47% missed their vaccinations. About causes of missing, the main reason is diseases of the children, 43%. Unfortunately, we didn't ask, did they come later for their vaccination? We should have a special research to do that. And also 31% had a fear to contract COVID-19. And for parents, it was important what institution did to prevent it during the visit. And also 27% told that the required vaccine was absent. Those parents who went to the institution, we asked them about anti-epidemic measures in the medical institutions. Women social distances, mask regime, and recommendations. And we were glad to hear that 84% of institutions announced that they did follow all anti-epidemic measures, and 7% didn't announce them or didn't follow them at all. And one of our last questions was advices from parents for the changes, and most of them told about that they need more information about vaccines, about its availability, to improve the organizational measures. And the distribution among the reasons was approximately 30% each. And the last question was, would you like to vaccinate from COVID-19? And among the parents who vaccinate children, 69.9% are not going to get vaccinated. And from those parents who do not vaccinate children, 89% are not going to get COVID-19 vaccine. And among those who registered for vaccination, almost all of them did it through their family doctor. So we should work in this direction as well. So, you know, we can see that those who wanted vaccination, who wanted to do it, they found a way to find information and to register. Which conclusions we can make based on the survey? Yeah, that is not scientific research, as Tetyana told before, and I would like to highlight it because of the number of participants, because of the selection, but still we can have some insight. First of it, that it is a need of full-scale research. Also, we need the information about the number of people who refused to do it, those who are serviced in the state clinics, and also high indicators of the missing in the target groups, and advices from parents to improve the process. And also we need to work on communication of the institutions during lockdown, and we do not need just communication in the institutions, but in other places as well. And we would like to thank everyone who made this survey possible. First of all, we would like to thank the Educational Ombudsman of Ukraine and his fantastic team for their efforts. Also, we would like to thank Public Health Center, Education and Science Departments, regional centers, and other stakeholders. Thank you very much. And now we would like to listen to the Maria Karchevych, who is working on transformation of the healthcare within the Ministry of Health of Ukraine. She is with us. Maria, Directorate for Digital Transformation Development Directorate, are you with us? Yeah, Maria is here. Wonderful. Could you please move a little further from the camera, please? Yes, now it's perfect. Let's start then. Maria, now we are talking about that full-scale survey. More than 70,000 of people took part in it. How the attitude of parents and workers of educational and healthcare care facilities changed during lockdown times. What you can add on it? Good day, everyone. First of all, thank you very much for invitation. I'm very happy to be with here today. We almost cannot hear you. Can you hear me better now? Yeah, we can hear you well. Thank you very much. Maria, could you please select Ukrainian in Zoom settings? Can you see the channels, English and Ukrainians? Could you please select Ukrainian channel? In this case, we will hear you better. Just a moment. And I would like to remind you that Maria Karchevych, General Director of Digital Transformation Development Directorate in Healthcare from the Ministry of Health. And she's a part of our next panel, initiatives of the authorities on the preventive vaccination during COVID-19 lockdown. Maria, what about your sound now? Can you hear me better now? Colleagues, can you hear me? Yeah, our participants say that they can hear you well, but we cannot hear you well. But the most important is that our participants in Zoom can hear you well, Maria, so you can carry on, please. Maybe I will try to talk, to speak loudly. Dear colleagues, I would like to present you the main issues on COVID-19 immunization campaign. Okay, so what we have in monitoring and analysis of the campaign, main parameters and results, what we managed to achieve already. First of all, the official source of information on COVID-19 vaccination is vaccinationcovid19.gov.ua. At this portal you can find basic information regarding vaccination campaign, what vaccines there are in Ukraine, how vaccines are stored, how they are being transported into the regions. Also, this portal you can find dashboards with main parameters of immunization. Also, at the dashboard you can see the immunization structure, I mean mobile teams, immunization points in the regions, interactive map of Ukraine. Also at the dashboards you can find information on provision of Ukraine with vaccines and stocks of vaccines in the regional warehouses, municipal and national warehouses. Regarding the source of origin of vaccines, we have two main sources. First one is COVAX Global Initiative. As you probably know, Ukraine is one of 92 countries that receives vaccines free of charge within this initiative. positive. And one more source is state budget funds. In our budget, there is a separate budget line for purchase of the vaccines. And some time ago, on the level of the Cabinet of Ministry, national COVID-19 vaccination plan was accepted. In 2021, 70% of Ukraine should be vaccinated. We are talking about adults 18 plus.
If we're talking about the kinds of vaccines, we are expecting 4 types of vaccines. First of all, it is AstraZeneca. On 24th of February, we had the first supply of AstraZeneca Covishield. It was 500,000 doses that were procured by national budget. Moreover, recently we had the second supply, 367,000 doses within COVAX program. All of them are already distributed in regions, and today, tomorrow, the regions start vaccination with this vaccine. Also, we expect 2 million of doses of this vaccine with procured by governmental budget, and plus 1.4 million from COVAX during May. Moreover, in Ukraine, we also have Coronavac vaccine from Novak, 200,000 doses procured by national budget. Also, we have the contract agreement for 1.9 million for 2021 for supply of this vaccine. Also, Ukraine has contracted supply for 10 million for Novak vaccine, and agreed on plus 5 million of doses. Also, we have Pfizer vaccine. As you know, recently we had 117,000 doses of this vaccine within COVAX program, and we're also expecting 947,000 more doses of Pfizer vaccine during May, June of this year. We already have confirmation on delivery in May of the supply of Pfizer-BioNTech vaccines. If we're talking about the platforms where the vaccines are used, we have 2 basic platforms. First of all, those are mobile teams, mobile immunization teams, trained teams, and also we have vaccination points. If we're talking about AstraZeneca, it is used by mobile teams. They perform vaccination in organized facilities among healthcare workers, social workers, and the military within the United Nations operation. Also, AstraZeneca is used in vaccination points during the first and second stage. We performed vaccination of 80 years plus population, and today and tomorrow the regions start vaccination with AstraZeneca vaccine for people of 65 years plus. For that, in regions we've prepared and implemented over 2,000 vaccination points. Coronavac vaccine vaccination is performed by mobile teams for immobile key populations and in organized populations such as National Guard of Ukraine and the military within the United Forces operation in the east of Ukraine. Pfizer-BioNTech is also used by mobile teams. It is used for staff and residents of nursing facilities, and part of this vaccines is also used for state service on emergency services and a state board service. If we're talking about the first results of vaccination campaign, as you probably know, According to the latest data in Ukraine, 539,133 vaccines were administered since 21st of February this year. 472,000 received AstraZeneca for CoronaVac, 38,940, and for Comirnaty, 27,600 persons. For now, we have over 300 mobile teams trained and over 2,000 vaccination points. It is important to note that in all 5 stages of vaccination in Ukraine, we are planning to form over 500 mobile teams and over 3,000 vaccination points. Vaccination points can be based in private and public healthcare facilities. In order for such point to be accredited, it should be accredited by the Ministry of Health, trained and certified by the Ministry of Health, and the healthcare providers will be contracted with the NHSU, since within the national budget it is also planned to pay for the mobile teams' work of the healthcare workers. Moreover, if we're talking about the results of the campaign, you can see the vaccination dynamics on the screen. As you can see, our tendency is that on weekends there are less vaccinations in regions from the obvious reasons. At the same time, during the weekdays, the dynamics is quite good, but the capacity in regions allows to do much more than is being done. The maximal amount of vaccinations during one day was 19,885 vaccinations in the beginning of April. If we're talking about the regions that are leaders in vaccination, it is Kyiv city that performed over 50,000 vaccinations. For now, the lowest amount of vaccinees are in Chernihiv Oblast, 10,276 persons. If we compare vaccination of males and females, we see that 5.6% more women are vaccinated than men. Also, people in the age group of 20-39 age are quite low. The lowest numbers are in the age group of 16 to 18 years old, and for now it is due to the reason that only Comirnaty is allowed for vaccination in the age group of 16 to 18 years old. All the other vaccines are for adults over 18 years old. Moreover, if we're talking about key populations, the highest numbers are among healthcare workers who work with COVID. 12.75% among all vaccinees. For today, Ukraine has received 1,184,000 doses of vaccines AstraZeneca, Comirnaty, and CoronaVac. Out of this amount, for today, we used 539,780 doses. It is 5.5% for today, 45.5% for today. Also, I would like to tell you more about basic approach to vaccination visits planning, and regarding this, we have 2 approaches to list formation. The first approach is making lists in organized groups within a the employers form the list of organized groups, and then mobile teams, according to their roadmap, planned their visits. As you know, the roadmap certified by the MOH, it covers 5 stages of vaccination, and at each stage there are priority groups that have the highest risk of COVID-19 infection, and vaccination of which is implied in this stage. For today, we've passed first and second stage, and we are in the midst of the third stage, and the key populations of the third stage are getting vaccines available in Ukraine. The second approach are open lists for vaccinations. Those are for people who are not linked to the employers, not linked to a facility. First of all, this is for older people. They can either join the electronic list, and not only them, any age group can join it. They can use either DIA app, DIA portal, or MOH contact center, and when their turn comes, they will get the opportunity to plan their visit and get the vaccine. Also, our people can plan their visit through healthcare facilities by directly contacting the facility through their family physician or through the medical information system that is set up in the facility. It is important to note that for today, in the waiting list, we have over 495,000 people, and out of those people in the age of 80 plus years old were already invited for vaccination, and they already got their vaccines. It is obvious that some of the people who got registered refused for vaccination, but most of them got their vaccines, and part of the people also asked to postpone the vaccination. Right now, the same procedure is performed for 65 plus age group. For now, people who are in the waiting list, we are inviting them for vaccination. Moreover, we've opened the opportunity to get into the list using contact center in facilities that have over 50 employers. In that case, the leader of the employer can register the list of his or her employers, and then mobile team will come to the facility. And right now, over 60 facilities are registered, and huge numbers of participants, from 50 to 9,000 employers. Also, monitoring and analytics in vaccination is comprised of 3 informational systems. We use informational analytical system metadata. Through this system, we perform the monitoring of the remnants of the vaccine in regions. Also, through this system, we monitor the refrigerators and gather information on the equipment and inventorization and the number of vaccine stocks within all healthcare facilities. The second system that we use within immunization issues is electronic system of healthcare. Within this system, we Within system, we add electronic data of patients through central database in healthcare facilities, and data on vaccinated patients is included in 2 registers of patients and of medical records in the electronic healthcare system. And the third system that we use within vaccination issues, it is the system automatized information system on pharmacovigilance that registers information on adverse events following immunization. As you know, AESI is split into 2 categories, serious and not serious cases, events. For now, we have registered 1,001 not serious event and 46 serious events, out of them 21 lethal cases. It is important to know that in every case is investigated, since regional operative response teams are working. They are following pharmacovigilance guidelines in Ukraine, and according to their evaluation, we get the information on whether the post hoc connection was established between vaccination and adverse event. And for now, none of the serious events was linked to the vaccination.
Also regarding the actual topic, vaccination certificates, this topic at the moment is widely discussed in public. It's worth to say that at the moment there is only one actual document of vaccination recognized at international level, International Certificate of Vaccination, that is provided by international medical sanitary norms, and it is issued with the signature of the doctor, and it can be prevented while you cross the national border. But at the level of World Health Organization, on the level of European Commission, at the moment there are active talks and there are plans to implement digital documents, smart certificates from WHO, and also this digital green passport from European Commission. Our country is involved deeply into these 2 initiatives discussion. At the moment, we are waiting for the final requirements from European Commission. A couple of days ago, we received technical specifications from them, and also we need to complete organizational procedures to start implementing digital vaccination certificate together with other European countries, but it will be possible only after European Commission gives their position on it. We are following the processes, and also we found thoroughly what's going on in Ukraine to give the possibility to our citizens who has been vaccinated to travel to other countries. It's worth mentioning that in these digital certificates, not only vaccination data will be introduced, also European Commission has proposed to put data on test results and availability of antibodies. But the final position on the certificate will be clear after European Commission will agree their point of view with World Health Organization. Preliminary European Commission told that they are planning to do it from June this year. That's all from me. Briefly, that was about Ukrainian national vaccination campaign. In the rating of countries, according to the yesterday data, Ukraine takes 81th line of the rating. For sure, we we can improve our place in rating, and we are waiting that with this new supply of AstraZeneca, our regions can show the capability of their 2,000 vaccination points to improve the national indicators of our country. That's all from me. Thank you very much for your attention. I'm ready for your questions. Thank you very much, colleagues. Interpreter cannot hear the sound from the speaker. The sound is very poor. Could you please explain why did we use less than a half of available vaccines? Is it due to the medical system that is not in a hurry with this issue, or because the population doesn't want to take it? Thank you very much for your questions. The sound was poor, but from what I said, what can I comment? About this 45.5%, there are a few reasons for that. First one is that the new batch of AstraZeneca vaccine, 367,200 doses, is going to the country today, tomorrow, and it will be distributed into the regions this week. And it will, you know, it's like a huge percentage of the vaccine that is available but couldn't be used. And other reasons that Novak vaccine, for instance. Mobile teams are going to elderly people, to people with disabilities who have no possibilities to come to the vaccination point themselves. So they are coming home to people, and take into consideration that distances are rather long. They have limited possibilities to cover everyone with the vaccination. 7 to 15 residential buildings they can visit during a day. And also there is a consequence of the vaccination. After the vaccination at home, medical team should stay with the patient to follow the condition of the patient. And also why we didn't use all available vaccines, limited possibilities to use them in the vaccination points, because at the moment there are lists of people who want to do it, but it's not enough for all people who would like to get vaccinated. That's why it is distributed between the priority categories of population for elderly people. That's why the speed is not as we would like to have it. If we have the enough number of vaccines in the territory of our country, it is obvious that the speed of the vaccination would be higher. We are waiting for the next batches in May, and it will be large. There will be large batches in May, in June, and national vaccination plan foresees 70% of the vaccination of adults till the end of 2021. It means that since June we will have 5.6 million vaccinations a month, and that's our target number. And we are getting prepared for the infrastructure development to be able to have this kind of vaccination. Also, there are talks about opening mass vaccination points in the big cities, like you could see in other countries of the world. Thank you. Interpreter cannot hear at all. Interpreter cannot hear the speaker. There is no sound. Colleagues, if you do not have any other questions, I'm very grateful for invitation. Thank you very much for your attention, and stay healthy and safe. Interpreter cannot hear the sound. Interpreter cannot hear. Interpreter cannot hear the sound. Interpreter can't hear the sound. Interpreter cannot hear the sound.
Це наше, це ЮНІСЕФ у них окреме опитування.
So now there will be other survey. And how important is communication in these issues. And now Anna Vysotska is with us. Hello, thank you very much for coming. Hello, I can hear you, but it's very low. Can you hear me? Yeah, we can hear you very well, thank you very much. Can you see my screen, please? Not yet.
Видно, так. Мені говорять, що видно.
Yeah. Now you can see my screen, right? As far as I understand.
Так. Добре, тоді починаю. Отже,
Okay, let's start then.
Доброго дня ще раз всім.
Good day, everyone.
І я представляю сьогодні ЮНІСЕФ. Я керую соціальним
And I'm representative of UNICEF. I am the director of communications program for UNICEF development in Ukraine. For over 15 years, we are working on vaccination topic, on communications with medical employees, and starting from 2008, we have regular sociological surveys, and through them we are following changes, detection of some trends regarding routine vaccination and the COVID vaccination including. So what about routine vaccination in COVID-19 times? You know, the survey that was made by parents for vaccination before me confirms the trends that we could see for the last few years.
Так, у мене трошечки не перемикаються слайди. Зараз вийду, мабуть, що з цього
I cannot change the slide, unfortunately.
Через те, що у мене не виходить перемикати. Так, хвилиночку.
Just a moment.
Ми зараз... Перепрошую.
Please bear with me.
Так. Чи повернулися слайди?
Can you see the slides now?
Добре. Тоді
Yeah, we can see them.
Не зможу я показати повноекранний режим через те, що в мене,
But unfortunately, you can see them like that.
Отже, тенденції, які ми спостерігаємо
Okay, which trends can we see starting from 2014?
Позитивне ставлення росте.
A positive attitude is growing. Neutral people are still on the same level for the last few years, 14%, and negative attitude, we mean vaccination of children, is 4% less among the parents. Three very important indicators. It's very important for people to be vaccinated and for vaccines to be efficient and safe. And those indicators we are following in the region, these indicators are being used by other countries as well. In 2020, these indicators were on the level of 80, 87, 68% of parents are confident in the efficiency and safety of the vaccines. So what happened in 2020 in lockdown year? We could see the drop among those who make vaccinations. If you compare 2019, almost 10% less parents are doing that. But what is good, they didn't move into anti-vaxxers groups. They just try to limit their children of excess contacts, and they made the most required vaccines. So they didn't refuse from all the vaccines. They just starting to select the most important from their point of view. So what's going on during pandemic? Here we used UNICEF tool on monitoring the parents with children younger than 2 years. The sound disappeared. Anna, we cannot hear you. Yeah, now we can hear you. Great. So what do you think about vaccination of children? 81% told that they are doing all the vaccinations and are confident about this decision.
We can see that further there is a small percentage of those who do vaccinate their children but are not sure, those who do but not all vaccines, those who do not do any question, very small percentage, only 4%. The true anti-vaxxers. Did your child receive all the required questions up to 2 years old? Only 75% responded yes, so we can see this drop in the end of 2020 that really was caused by the pandemic. Why? What are the main reasons? Some of them delayed the question due to child's illness, but 27% did not vaccinate their children due to the quarantine restrictions. During the quarantine, most parents refused by their own initiative, but 15% healthcare facilities recommended not to vaccinate children during this period of time. Also, why parents who delayed did not vaccinate the children, who did not vaccinate their children with their own initiative, or what was their motivation? The most risk factor was fear of getting COVID in polyclinic due to the accumulation of people. And yes, we are talking about the fact that the vaccination procedure should be organized safely, as Fedor Ivanovich has mentioned. It can be done very easily, but it should be done so that the patient can come safely, get all the procedures safely, so there is no crowd, so that there is a sequential visit, but there is no line in the waiting room. Did you talk to a healthcare professional before visiting the vaccination point? And half of the patients said the doctor did contact them in order to remind that the child needs vaccination, and it is a very positive aspect, we think. And also almost 40% talked beforehand to define whether the children have to get the vaccination and how to do it better. So yes, almost half planned their visit with the doctor, which is a very good practice. There is also a question that we asked, which has positive and not so positive practices. Combination of vaccines with other procedures in order to decrease the number of visits. Almost 60% of parents had this recommendation, received it from their healthcare worker. Also, only 66% of healthcare workers said that you should administer several vaccines, multiple vaccines in one day, or use multi-component vaccines. This is a very concerning factor, and also you should not the recommendation not to use multiple vaccines in one day. 27% said that this was recommended to them by healthcare worker. It should really be addressed because there is a lot of educational events held by us and our other partners on performing multiple vaccinations during one day, one visit, and it should be already a regular practice in Ukraine. Also, most patients got the recommendation that they should better call beforehand before going to the healthcare facility, and 14% had the recommendation that it is better to delay or cancel routine vaccination during quarantine, which is another concerning fact, and we have to address it. Another cross-section is from our last study on vaccination and COVID-19 vaccination. Last year, these are sociological studies that are performed with the project sample, national representative, and so on. So it is important that the child is vaccinated, had all the vaccines. We have different groups of people, those who rather agree. In general population, parents of children up to 6 years old, the middle column, and people of 60 plus years old who agree with this thesis. We also have the statement, vaccines are effective. It is another thing that we monitor. Mostly parents of children up to 6 years old agree, and again we have other groups too, and vaccines are safe, almost the same among all groups, but most people do think so. What was interesting, I will not present all the conclusions on COVID-19 study, but it is a very interesting issue, and we see it within other data on routine immunization. Older people, grandmas and grandparents of children have a more positive attitude to vaccination in general. They are more compliant, they have less fears, and they are more motivated to vaccinate their children. And we can see now in 60+ age group for COVID-19 vaccination. So it is a very powerful driver among the audience, the very good population to work with on fighting the barriers, overcoming the barriers for vaccination. And in the end, I would like to add, since as I can see, we have participants from different healthcare facilities, since we perform a lot of trainings, online trainings for healthcare professionals. Here are two useful materials for you: 4 steps for effective communication with parents on vaccination, on consulting for healthcare workers, and recommendations for teachers, how to talk to parents about vaccination. Because also it is very important that this topic is supported among the educators. These resources are available on the UNICEF webpage, unicef.org.ua. You can follow the link and download these recommendations and use them. And please join our channels because we have a lot of educational sessions, educational materials on YouTube and on the web page for healthcare workers, and it will also be useful for parents. Thank you. If there are any questions, I will be glad to answer. Anna, thank you. Anna Sukhodolska, Director of Communication Programs for UNICEF Development in Ukraine, is here in Zoom with us. And now we are switching to our next speaker, Educational Ombudsman Sergei Gorbachev, who is also joined with us. Let's check whether everything is okay, and we will give the floor to you. The sound is very poor, so the interpreter cannot hear the speaker, unfortunately. So children are on online education and how it will impact the vaccination. Are educators promoting vaccination? What is happening there? So is Serhiy here with us? Yes, I'm here with you. Okay, great. We can see you. We can hear you well. So please, floor to you. Good afternoon, dear colleagues. Thank you very much for the invitation, for the opportunity to participate. I will be speaking shortly. I will comment on a few topics on education. Thank you, Anna, for your presentation, for the quality materials that we can work with. But I would like to note the following. We support, so to say, we support vaccination, we support protection of healthcare workers. As an educational ombudsman, I think, and I have no doubts that the most important right in education is right for health and life, and this is the right that I will protect, because when I hear the concerns that you have to allow unvaccinated children to go to school, I always respond that if a child or a teacher gets sick, then education cannot be provided. So vaccination is key for education in Ukraine. And now, regarding our topic of discussion, very important, very interesting information that I've heard. But I would like to emphasize the humongous risks associated with neglect and lack of critical thinking among the public and group of people who professionally should have had a different opinion. I mean, doctors and teachers, because we see and hear this refusal and this sabotage among some healthcare workers regarding vaccination. Sometimes I am so surprised, I'm flabbergasted by it. I will give you the example. A few days ago, vaccination of teachers who participate in ZNO, external independent testing for children using CoronaVac vaccine, very important step. But in one of the regions of Kiev, the leader of healthcare department, I will give the name in private setting, not now, seriously stated that during the vaccination, no information on teacher being vaccinated is recorded. Teachers do not receive the vaccination record. It is not documented anywhere. And because of that, many teachers who were ready to get vaccinated refused the vaccination. I had a very unpleasant discussion with directors of a few educational facilities that should have stopped this from happening, but the situation exists, and it exists because of poor quality communication on infection prevention. So I am asking healthcare system to please put the most detailed attention to communication efforts. You cannot disorient and scare people who are already disoriented and scared. It is very dangerous for all of us. The second thing, for me it is very important to understand that we are united in our action. And right now, Anna has mentioned a very important document, recommendations for teachers on how to talk about vaccination. But I have to note that when on Educational Ombudsman website we placed a post on this material, which I think is very good and interesting. The Educational Ombudsman, me personally, I was bullied because the amount of negative comments and threats I have never received in my life before, and for me it was very important to get the support from people who are professionally working with it, but I did not receive this support. I just got the answer that people who are doing this work do not get involved in discussions with anti-vaxxers. It is wrong. If we are acting united, we have to be united and we have to protect our parents and teachers. And to withdraw from this unpleasant, I understand it is unpleasant to talk to aggressive people and it is emotionally exhausting, but excuse me, we have to do this. I was not scared by this. I will continue to stand up for vaccination, and with huge interest I was listening about the results of studies, but I did not know for myself, which is important, were these surveys held before the decision of the head court of Ukraine on vaccination as a requirement for public health and public interest priority. I would like for us to concentrate on these legislative norms, and so that it is noted in the questionnaires too. And I'm sorry, the anonymous survey is very good, but it is very weird. The question, what is your attitude to legislature on vaccination? I'm sorry, but it is very weird because you're provoking me, you're aggravating the opinion of maybe it is not needed, maybe it is not important. So let's be decisive and let's support each other, because without this support, without shared pressure on this communicational work, we will have what we currently have, very strong anti-vaxxers. Thank you very much. We will work further and protect the health of our children, our parents, and our teachers. Thank you.
Thank you very much indeed. We have some precisions regarding your presentation. I couldn't hear you very well. When did you make that survey among parents and medical employees? Hello, Sergei. So the surveys was made during those 2 weeks, and that's why information that we get based on the solution of European Commission on national legislation. Regarding all the issues, they will composed on the base of global experience, on evidence-based materials, and they were adapted to the realities by the best Ukrainian experts dealing with these issues. That's why we will think in our next meetings how we can formulate them better for employees of educational sphere. We will share all the survey results, and also we are going to have expert recommendations how to work in the future, taking into consideration the statistics, information, huge number of open comments that we got, as more than 17,000 of educators took part in this survey, 70,000 of parents, a few thousands of medical employees. There are a lot of things to be considered for the future, and I'm sure we will be able to make some advices useful for educators also. I will be very grateful to involve Ministry of Education. Unfortunately, Deputy Minister couldn't attend us today. Let's hope that the Ministry of Education will be involved on the next stages and we will implement it together. Not to have those cases when powers of educators for the protections are being violated. Thank you very much for covering this topic. You can always rely on us on this issue. We do not have any other way. Our only possibility is just to manage it all. Thank you very much for our fruitful cooperation, because without it we cannot get our 95%. Thank you very much. Let's continue talking together, but I would like everyone who is making survey to think about what questions should be asked. For instance, the questions like, do you how it was it? As for you, is it incorrect that massacre is a criminal offense? I'm sorry, but you know that anti-vaccination, that's a very dangerous thing. We cannot support this opinion in any way, so I would like to ask you to reconsider the questions. Also to ask the people, do they know about the ruling of the European Court of Human Rights, about European Commission, how to protect themselves from infectious diseases. Thanks God we have a very clear, very well formulated position that give us a clear tool to protect public health. Serhiy, thank you very much indeed. Sergei Gorbachev, educational ombudsman, was with us. Very expressive speaker for the vaccination. It's very useful for his position. And now Svitlana Dudnyk, who is the head of Directorate of Digital Transformation Development in Healthcare of the National Health Service of Ukraine. Svitlana, wonderful. We can see you well. What about your sound? We can hear you. So, Svitlana, the floor is yours. What about your service? What do you want to share with us today? First of all, good day, everyone. From the National Health Service of Ukraine, I would like to thank the organizers of the conference that you are covering such an important topic for all of you, or for all of us. And briefly, I will tell you about initiatives and about immunization coverage, the role of National Health Service. First of all, vaccination is a part of medical service within medical guarantees program. What does it mean? Healthcare institutions that have an agreement with National Health Service free of charge, can vaccinate population according to the national vaccination calendar. Vaccination is being made within few packs. First of all, it is a primary medical help package, and vaccination can be done to adults and children against 10 infections: TB, pertussis, rubella, measles, BCG, and some others. And adults are also vaccinated at us within the national calendar every 10 years, diphtheria and tetanus. And also those institutions that have agreement with National Health Service can give vaccinations to the children who were just born against hepatitis and BCG. But if there is no vaccine and vaccination didn't happen, parents can vaccinate the children on the level of primary health care in any kind of medical institutions where the child will be followed at pediatric doctor or family doctor. And also if there is a need to get vaccination against rabies, you also can do it within one of the packs. And also, in response to COVID-19 infection, National Health Service created vaccination against COVID-19 package. And this package included the following forms of medical support: mobile teams, establishment of stationary points to cover more population. Why it was created? To make additional payments to our medical employees, because their workload is huge at the moment, and also to cover equipment and materials required for these processes, and also regarding the statistics of medical means. I don't want to overload you with numbers, but maximum information you can find on the website of National Health Service of Ukraine. You can see all the institutions, which packages did they contract, so on and so forth, which services can be provided. You just need to go to the website of National Health Service. But regarding initiatives that was made by National Health Service, and that's very important initiative, that at the end of 2020 National Health Service started developing digital part of the health protection system with the information on every case of vaccination in Ukraine, and that model finally starting from January 2021. For the time being, every case of vaccinations are being inserted into the system. We get data, and thanks to that we get additional possibilities. What kind of possibilities do I mean? First of all, we have information real time. Also, we have reliable actual information. Also, we receive possibilities to have wider analysis. Also in correspondence of the events to the national vaccination calendar. Also, while doing analysis, we can have indicators of the vaccination for Ukraine, for some regions, for some different categories of population, and also regarding every vaccine against some diseases. And as a result, we can have more efficient preventive work and to take better managerial decisions on the national level. And one more important factor, we can analyze the need for vaccination. Just yesterday, I was looking at the database. It is filling in actively, and I can tell you that vaccination process, I do not mean COVID-19, I mean vaccination of children. And the next thesis, that is an initiative of National Health Service that was started within Medical Guarantee 2021 that started on the 1st of April. We decided to start this work to reinforce the preventive component on the primary health care level. Within the pack of primary health care, the first step was made. Quality indicators were introduced on achievement of sufficient vaccination level of children according to the vaccination calendar. The first indicator that we selected was the achievement of target level of vaccination coverage by MMR vaccine, 94% and more, for children younger than 6 years old. For that, National Health Service make additional payments for those institutions that cannot achieve these indicators, and the evaluation will be made once in 3 months. The start of the campaign was the 1st of April, and the first evaluation will be made on the 1st of September. According to our data, it will be made digitally, and the volume of additional payments to the institution will be 5% of the factual payment during these 3 months, and there will be absolute additional funds that institution can get to their basic rate. That's a very good stimulation for our family doctors that are overloaded at the moment due to COVID-19. And at the same time, the prevention will be better to prevent additional epidemics, outbreaks of other diseases. That's all that I wanted to share with you. Thank you very much. Thank you very much, Svitlana. That was Dudnyk Svitlana from the National Health Service of Ukraine. And she told us very interesting event that her service will stimulate the family doctors for routine vaccinations. And now, Serhiy Zavadsky, the head of the National Committee of Polio Plus, Serhiy, hello. Serhiy is the head of the National Committee Polio Plus, and as far as I understand, you have slides, right? Hello, Tetyana. Hello, Tymofiy. First of all, I would like to ask your technicians to put my presentation on the screen. I sent it to you because I wanted to change the slides centralized. And now I'm very glad to see you, and I would like to congratulate those 66 people who are watching us at Zoom and probably at some other channels as well, those who are with us for 3 hours already. Here I'm representing Rotary Club in Ukraine, National Committee Polio Plus. That is a national committee of this international civil society organization. Rotary is a global network of Rotary clubs that joins 36,000 clubs almost in every country of the world. 1 million people of Rotary community, very active people who are doing that alongside with their main activities. Sergey, if it's possible, could you please speak louder as usual? Now it's okay. Thank you very much. So the people are united into Rotary clubs to have some kind of social projects, first of all in the interest of their own communities.
And what do Rotary clubs have on vaccination? I will explain very shortly. For those who maybe do not know, Rotary works with many projects in different areas, focused in some areas, and healthcare is, for many years, has been a huge area of work in which a lot of projects are implemented, but our main global project, Rotary, has been initiated by Rotary and then organized with the involvement of our partners, the WHO and Kids Fund, UNICEF, and other international partners, polio elimination. And vaccination is the tool that allowed to implement. We are almost in the end of this fight, and I will tell you where we are in detail. And now I would like to switch to the next slide. And Rotary continues as an NGO in Ukraine. We work in Ukraine too. And during the pandemic, we use three principles that help us to implement our activities in these hard times. The first principle is individual actions have the biggest impact on incidents. This includes personal hygiene, social distancing, vaccination, and other WHO guidelines. We have to take personal responsibility in order to stop COVID-19 spread. Rotarians are an example in this since the very beginning of the pandemic, and medics, healthcare workers who are members of the Rotary, were one of the first vaccinees. And this picture is very tiny, but you can see this is the governor of Rotary in Ukraine. He is vaccinated as an opinion leader. He was conscious in his decision, and he uses this fact in order to communicate on the need and the efficacy of vaccines as an example. So we are working on vaccination not only from polio but for other diseases too. The second principle is support of governmental efforts on flattening the curve of incidence. This should be united efforts of the government, of NGOs, scientists, healthcare workers, the whole society. In Ukraine, Rotary clubs are very much involved in scaling up the capacity of healthcare facilities in fighting COVID. The third principle is spreading the messages of hope and reminding people that together we will fight this disease, and delays and barriers in our life are not only temporary, they are critical parts of continuing our life. Rotary clubs are active in fighting COVID-19. Next slide, please. We support hospitals by providing different equipment that is very much needed right now. Not everywhere there are enough oxygen concentrators and PPEs. Next slide, please. And hygiene supplies, especially in the beginning of the pandemic, it was very much needed. Next slide, please. And Rotarians lead by example as active civilians, as volunteers, by working personally, even during the pandemic, by supporting healthcare workers, facilities, and supporting the elderly. We also do not forget about our main program. The work on ending polio is continuing, and we are very glad that due to the efforts of all of us and of our partners, of course, some part of it was due to the social distancing and additional PPEs and hygiene measures in the last year, but in 2021, today we see only 2 cases of wild-type polio infection in the whole world. In the whole world, you can see how close we are to ending this very dangerous disease, about which many people in Ukraine have already forgotten, but still this disease is very dangerous. Our experience on organization of this fight against polio, the program is called Polio Plus. It means not only polio. Due to Rotary efforts in different countries of the world, in some countries, especially in African countries, the overall healthcare system, it was not really existent, and due to our efforts, it appeared and it helps to fight the COVID-19 pandemic. Next slide, please. And in the end of my speech, I would like to show you this short video in which we encourage all Rotarians. We have a lot of similar videos in Rotary. We will demonstrate it in a second. It is very short, 5 actions against COVID-19, and I would like to finish my speech with these 5 actions when we will adapt this video into Ukrainian. First of all, 5 actions against COVID. Educate your community on the importance of vaccination. Second, advocate for fair and equal distribution of vaccines. Address vaccine hesitancy by sharing accurate, fact-based information. Encourage mask wearing and hygiene practices. Support health agencies on vaccination scaling up efforts. Together, we will end the pandemic. And to this list of 5, we will for sure add support routine vaccination against dangerous diseases, and by individual example and promotion of vaccination, Rotary together with NGO Parents for Vaccination, in the creation of which we took part, and Rotarians are currently in the board of this organization. Together we will fight and end the pandemic, hopefully, and we will get to the targets of vaccine coverage for routine antigens. Thank you. Thank you very much for such an emotional speech. Serhiy Zavadsky, head of the National Committee Polio Plus Rotary in Ukraine, was here with us, and now I would like to give a floor to Denis Denisenko, Executive Director of Coalition Reanimation Package of Reforms. While he's connecting to us, Tetyana from USAID says that she could not hear the whole presentation of Sukhodolska, but she said that the routine vaccination work is supported by the USAID. Tetyana is here with us. She says that she has problems with the internet. Denis Denisenko is here with us. Okay, Denis, please, floor to you. We can see you, and it seems like we can hear you too. Can you hear me? Yes, it's perfect. Great. First of all, I would like to thank Parents for Vaccination and partners for the constant support and support of the reforms. Coalition Reanimation Package of Reform is always supporting the civil society and governmental activities in our organization and building of transparent system of client-oriented public health. I would like to add that one of the key positive decisions was implementation of strategy of the approval of strategy on immunoprophylaxis, which implies that these activities will improve compliance, overall compliance to vaccination. We can see that still many parents and educators, many people are hesitant about vaccination even during COVID-19. Also, it is important to note that the acceptance of this strategy and its development became possible thanks to the active position of the civil society, and thank you to our partners, Tymofiy Badikov, for the active promotion of this strategy. But today, there is a list of problems in implementation of the strategy, especially in regions which requires support of civil society and building of effective healthcare system in regions, which is still a challenge. And we are ready to support you here to unite efforts in addressing these problems. Also, it is important to own the public within the pandemic has priorities. We also stated it in our analytical briefs on healthcare that will be shown on Ukrainian Farm Conference in July. So we completely support these efforts by the Parents for Vaccination organization. Thank you. I'm speaking very shortly because we already passed our time limit. Yes, Denis, thank you very much. Unfortunately, part of your speech was eaten by our poor connection, but I hope that everybody understood the essence of it. So thank you, Denis Denisenko from Reanimation Package of Reforms. And now I would like to give the floor to Iryna Voloshyna, family physician, professor from Association of Family Medicine in Ukraine. Is Iryna here with us? Good afternoon. Great, great. Finally, we have good connection. Please, floor to you. I will share my screen. We can see you, can hear you, so you can already speak. Dear colleagues, I'm very grateful for the opportunity to be present here today at such a high-level event on Immunization Week. I understand that we've been here for over several hours and we might be tired, but I am honored to represent the activity of NGO Parents for Vaccination within cooperation with international and national partners, and I'm very honored because we've talked a lot about the need for involvement not only parents into vaccination topic but also the family physicians, and I'm a healthcare provider for our patients. I am a sole entrepreneur, sole proprietor physician, and 5 minutes ago I got the good news that we got 50 doses of Covishield, and in our private practice we can also start vaccination, just like the communal enterprises, and it is a very important step because sole proprietor physicians are currently serving millions of people in Ukraine, and we can stop pandemic faster in that. In the context of cooperation with partners, I am very pleased to see that such powerful international organizations and persons such as the WHO, Public Health Center of the Ministry of Health of Ukraine, the Educational Ombudsman, UN, International Fund Renaissance, GIZ, German organization, Ukraine-Switzerland program, development of medical education, Your Family Physician Project, and Academy of Family Physicians in Ukraine, and Ukrainian Academy of Pediatric Specialties. All of us, we are united in the sole network that supports vaccination, and for that we are very grateful, and I would like to share what we're proud of, what we managed to do lately. First of all, we updated our manual on answers to questions from parents about COVID-19 with the support of Renaissance International Fund. Also, together with our international partners, we developed a manual of 100+ answers to questions on vaccination against COVID-19 for healthcare workers, and now this manual is available for free on the Public Health Center web page, and we are expecting the print of handouts for its distribution in regions. And on this slide, I would like to show another thing we're proud of, that we joined the national schedule for vaccines with the vaccines that the government can buy and the recommended vaccinations, and it is very important for parents to understand which vaccinations when they should do, and I'm very grateful to Fedor Lapiy, who put a lot of effort into creation of this joint calendar. And now, what we've also done.
Within our activities, Parents for Vaccinations, we covered 100,000 population of Ukrainians, reviewed educational programs, reviewed webinars with the participation of Ministry of Health representatives, public health centers, educators, educational ombudsmen, representatives of external school education evaluation, and also we had a few brief but info-packed programs that will be broadcasted in the national TV sometime in some time and on YouTube as well. And also we hope that we will raise the awareness of the general population. And our main direction in 2021 in the context of support vaccination and interaction with our partners is the adding of vaccination digest with the help of Renaissance Foundation and our partners, distribution of 5,000 copies of paper digest into the regions with answers to their questions, as paper guidelines are in demand. They're waiting for them. Together with GIZ, we are planning to start developing mobile app on vaccination and to pilot it in the east of Ukraine, and also to educate medics of the communities based on peer-to-peer principles on immune prevention. And we have this project together with the Switzerland Education Center, because that was their initiative. That's all from me. Thank you very much for your attention, and I will be very happy to answer your questions if there are any. Iryna, do you understand that you became the first sole proprietor physician who will start vaccination? No, I'm not the first. I know that in Poltava region, private clinic got those vaccines, in Kharkiv region as well. And the doctors that I know received the vaccines. We can see that it started, and I think that's a very powerful, very important step for our society. I just remember the declaration of the Minister Stepanov that by September private clinics will have vaccines. And thanks God that we got it in April, not in September. Thank you very much, Iryna Voloshyna, family doctor from the Association of Family Medicine of Ukraine. And now I'd like to give the floor to Oksana Polishchuk, who is the head of kindergarten number 47 in the city of Melitopol, Zaporizhia region. As far as I understand, Oksana wants to share with us success stories, how they worked with parents on preventive vaccination. Oksana, we can see you. Hello. Well, let's check your sound. We can hear you well, thanks. I'm very grateful to the organizers of this conference that you involved us into such an interesting topic, because for many years already we are working actively and fruitfully with prevention, awareness raising among children and adults on vaccination issues. We understand how serious is the situation with infectious diseases for the recent years and understand that the proper awareness raising of adults and children can change attitude to vaccination and impact to the nation health. We had research among parents on their attitude towards vaccination and found out that 15% of them do not support vaccination. Is it too many or too small? We don't know, but for herd immunity we need majority of the population to be vaccinated. And when we discuss vaccination with the parents, when we discuss vaccines, immunizations, we understood that we forget about the disease itself. And after working for so many years with parents, we recommend to discuss the disease itself with them, its dangers, to make it a priority, as parents should evaluate themselves how hard can be adverse events from the vaccination. Regarding the issue on children without vaccination, do they attend our kindergarten? No, they don't. And there is Article 15 of the law of Ukraine on protection of the population from infectious diseases, and we are not allowed to admit them. And by the end of 2017, kindergartens could vaccinate the children according to the vaccination schedule, but at the end of 2017, those duties were given to the medical institutions. But still, we are monitoring the situation. Parents inform us through some personal connections, by internet, by email and Viber, what vaccine did they make. We have records of those vaccinations of our kids and can remind the parents about vaccination calendar. We can remind the parents that they need the vaccination from some other diseases, to have some preventive actions. And now I would like to give the floor to our chief nurse, Galina, who is working actively. Also, she has a very good civil position and a huge responsibility on this issue. Good afternoon. You know, we were discussing for a long time how to work with parents, that vaccination is a useful thing, and we started telling fairy tales to the children on this topic. And they perceived it very well. They took part in those fairy tales, and parents also started participating in the fairy tales. First of all, they started listening to them attentively. It became interesting for them. They started talking to each other. Our parents are the ones who take active part in the fairy tales. The children come home happy, and we can discuss recommendations on the vaccination after that. Before 2017, our kindergarten was one of the vaccination leaders. We are very proud in this achievement, and now we are trying to work closely with parents still. And regarding COVID-19, we are trying to prove the parents that they should make this vaccination as well, because that is a very serious disease with huge consequences. And we can see that parents are listening to us. Some of them have been vaccinated already. Our employees are also being vaccinated. I'm sure we will be fine. And here you can see our kids. We can see your kids, we can see your staff. Nice. Yeah, our musical teachers very active also in this issue. Just everyone is involved. Thank you very much, Galina. Thank you very much, Oksana. That were representatives of kindergarten from Melitopol who told us how to work with parents to cover more children by routine vaccination. And other participants of roundtable from Zoom conference joining us, Anna Kukharuk, for instance. Anna, can you hear us? Yes, we can. Anna, could you please tell us what are you doing? Good day. Can you hear me well? Yeah, very well, thank you. At the moment, I'm the head of the Department of Immune Prevention of the local public health center, and also I'm the regional coordinator of Parents for Vaccinations in Zhytomyr region. So please tell us about routine vaccination during COVID times. Do you have less people who are being vaccinated? How do you support parents and children in this idea? And what about your situation with COVID?
Вакцинах, які невеликих, десь пропав звук, ні?
Can you still hear me? Now, yes.
По невеликих амбулаторіях, якщо там, наприклад, був один лікар-медсестра,
For instance, we had just some small clinics, and if there was just one doctor and one nurse, and the doctor is with COVID, so this vaccination point was closed. We cannot foresee them. It was always unexpected, and we had the situations from the side of the parents. There were doubts and fears. And also they had less checkups in the medical institutions. Some of them didn't bring kids for routine vaccinations. I had patients who were waiting for 6 months for lockdown to finish, but after that we made with them routine vaccinations at last. Also in parallel way we have COVID vaccination points. 82 new points will be open from tomorrow in our region, and that's for the people 65 plus, and also for some categories of population, medical employees, pharmaceutical employees, people who are working with medical institutions but who are not doctors and nurses themselves. That's one of the target groups for vaccinations. Now you can register for your family doctor for one of the vaccination points in your city and to get free COVID vaccination. Besides, private clinics are started vaccinations also. They made contracts with the National Health Service of Ukraine, and tomorrow 2 private clinics will start vaccinations. I'm talking about Zhytomyr and Lyuboryar. Also, our activists are working closely with the representatives of public health centers. Our cooperation is the communication with other state authorities, I mean healthcare department, municipal and regional
і простіше комунікувати.
Also, it's easier to communicate with the institutions. For instance, the information that we gathered for polls with parents, communication centers of public health centers in our region helped us a lot. Also, we contacted representatives of education to distribute this information among the teachers. Also, medical employees could fill in those questionnaires at the website of public health center. Thank you very much, Anna. That's very interesting indeed. Can you see in Zhytomyr region they also started vaccination in the private clinics? Anna, thank you very much. Marina Mamenko is also with us today. Marina is our participant from Zoom. Marina, let's try how we can hear you. We can hear you well. I cannot hear you, but probably Zoom does. Marina, could you please select in Zoom settings Ukrainian channel, if you can hear me? In this case, we can hear you.
Налаштовую, я хочу додати таку маленьку деталь.
And while Marina is setting up, I would like to add a tiny detail that during Zoom, in Zoom we see that right now teachers that are involved in the ZNO test are vaccinated and other educators will be vaccinated later. So now we are providing vaccination in order to prepare educational system to the graduate tests for high school students. Yes, Tetyana Rastrigina did not manage to connect to us from the USAID, and she is texting in chat that the USAID will support UNICEF projects on immunization and CDC projects presented by Umid Sharapov until September of 2021. Is Marina Mamenko here with us? Yes, okay, now it's all perfect. We can hear you. Please tell us about your work. I'm the head of board of Ukrainian Academy of Pediatric Specialties, NGO. Our organization was mentioned already several times by Fedor Lapiy and Iryna Voloshyna. We unite pediatricians and family physicians who also care for children, and I think those physicians, the family physicians, are the most progressive part of our community. Vaccination has always been our priority. It is one of the key topics of our Prime Pediatrics Congresses, which is an event with CME credits. At least 3 to 4 times we hold other powerful conferences, again with international accreditations. Our organization represents Ukraine in the European Academy of Pediatrics, which allows us to participate in international research and studies regarding parents' attitude towards vaccination in Ukraine. And I would like to say maybe it is not a representative sample because it was performed by the doctors of our organization. And I think that the attitude of healthcare provider to vaccination influences the attitude of the population they serve. Our results were comparable to Poland and Israel results. Hesitancy was present among around 40% of respondents, but with quality work of healthcare providers, the hesitancy could be eliminated and improved. And here I think that we have a large contribution, and our committee of vaccination is chaired by Fedor Lapiy, so we are doing it very professionally. This is probably the main thing. We've also joined the efforts on COVID-19 vaccination, and here I understand as well, just like other professionals, that until we since we cannot protect children with COVID-19 vaccines, we protect adults that surround them, educators and healthcare providers, and even hashtags and campaigns such as "I'm a doctor, I vaccinate." I can see that many participants of our organization joined this initiative, me included. We changed the attitude of healthcare workers to COVID-19 vaccination too. Thank you. Marina Mamenko, head of Ukrainian Academy of Pediatric Specialties, was here with us today, and I know that Umid Sharapov is somewhere here with us, who is a representative of USAID, I mean CDC, US CDC. He is somewhere here with us, but here you are. Okay, Umid. Hello. Hello, can you hear me? Yes, we can hear you very well. And we can see you very well. Please, floor to you. Thank you very much. I would like to first of all thank the organizers of the event for the invitation, as well as the participants who presented the slides, the speeches with important data. This roundtable is a very important event, and I sincerely commend all the participants. The information that was given to us was very good. We received information on the achieved progress and on the current problems that we face within the immunization. I would like to tell very shortly that CDC office in Ukraine supports immunization development program. We cooperate directly with key organizations such as UNICEF and the WHO, programs that are financed by the European Union and other partners, as well as our key national partners, MOH, PHC, lab centers, etc., NGOs, National Technical Expert Group, and other organizations. And as Tetyana mentioned, USAID supports and funds program on immunization, which includes SafeMed, WHO programs, UNICEF programs, etc. Since we are limited in time, I would like to very shortly encourage family physicians in Ukraine to tell more to their patients about the benefits of COVID-19 vaccination, and also discuss routine vaccinations with your clients. Local surveys, including the big UNICEF survey, showed that most Ukrainian citizens trust their family physicians, but also many participants said that they did not receive information on COVID-19 vaccines from their family physicians. This issue was raised multiple times, and right now we're in a very active process on communication to open the opportunity of COVID-19 vaccination at the family doctors level. And as this data show, the presented by UNICEF data show that, again, pediatricians and family physicians are one of the key sources of quality information for patients, and they can do more for improving health and well-being of their clients by encouraging them to vaccinate. I was very glad to hear the news from Iryna Voloshyna that her practice will get the COVID-19 vaccine and she will start vaccinating her clients. It is very good news. I think that the more family physicians are prepared, the more family physicians have this opportunity to vaccinate their clients, the more rapid will be the increase in coverage. Also, we are on the same page with Iryna Voloshyna. I would like to put your attention to the fact, to the developed document developed by the Ukrainian experts. Iryna Voloshyna mentioned it too. It is 100+ questions and answers on COVID-19 vaccines. I will send you the link to the comments. This document is oriented on questions on COVID-19 vaccines, but it also has important information on routine vaccination. Me, for example, I'm sharing this document with my colleagues already, doctors and not doctors. This document is in Ukrainian and it helps many hesitant people to change opinion and attitude to COVID-19 vaccination. It is a very useful document. Thank you very much to the organizers for giving me the floor and for the good organization of this event. Thank you very much, Umid Sharapov. He is the representative of CDC and Doctor of Medical Sciences, epidemiologist of the Global Immunization Department and CDC. And obviously, now we are wrapping up our discussion today. We learned a lot about the successes and some failures, some areas for improvement, and things we can do to reach those 95%. From my side, thank you very much for the opportunity to moderate this roundtable. I learned a lot for myself, and I hope that for our speakers and our listeners in Zoom and in YouTube and Facebook, this event was also useful. So, Tymofiy, floor to you. Yes, thank you very much, Tetyana, for the quality moderation. Thank you to all members of the team. I would also like to add that unfortunately 3 hours is not enough. We plan to do it for 2 hours, and we wanted to give the floor to as many people as possible. And even though some of our participants are very busy, the members of parliament here and deputy ministers was planned to be here, but still we had representatives of the government, of healthcare workers community, of the general public. We always try to give the floor to everybody and to hear everybody's voice. So what was not said today, but it's very important, that within our project we are also planning to involve local government to more proactive work. For example, one of our organizations to the government in Kyiv too, so that during the recording, during this recording, the information that was shared on vaccination in the kindergarten, it was of key importance. And even though we are in the midst of COVID pandemic, we are still responsible for the vaccination of our children. And even parents that are hesitant, that have hesitant approach, we still try to convince them. And even a lot of ex-anti-vaxxers joined our organization, and they became proactive pro-vaccinators. So thank you to our partners, to the WHO, thank you to the MOH, the Public Health Center, experts, medical communities, and I would also say that we have the Coalition for Vaccination that unites the lead experts in the leading NGOs. So those who are not part of the coalition yet, please join us. Let's make this umbrella just like the one we have in our background, so that our team has this strong umbrella from infectious diseases, and so that it is not by accident, so that it is continuous, so that the government, the ministry, the government, so that all the initiatives that we do are implemented, and so that we are not this black spot on the map of Europe, but so that we become one of the leaders. So I wish health to all of us, and let's vaccinate because we're worth it. Thank you. Let's vaccinate and get together. We heard this motto today too, and I think we will all get closer if we get vaccinated. Not less than 95% 95% of coverage for routine vaccination. As Fedor Lapiy said, don't forget to vaccinate your children against diphtheria and tetanus. Don't forget about routine vaccination. It is of key importance because, as we today heard, we will raise this question more actively in schools and kindergartens so that your children do not get these unpleasant infections, so that you do not need to rush and search for vaccine in case you get contact, you get trauma, you get injured with a steel or metal. I know I had this situation. Thank you very much, everybody. See you again.